Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. Hello, everybody. Welcome to another episode of The Cold Hard Truth. Good morning. Happy Tuesday. Let's check in with Blake and Aaron over at 106.1 FM.
Hey. Yeah, we've got about 50 seconds until we go live on KISS. Good morning. Hope everyone had a fabulous time last night at the drone show. Was that?
Yes, I actually got to see it on Saturday.
Oh, was it Saturday?
Well, they had it last night again.
Okay.
So,
that's what I thought. Okay.
Yes.
Oh, you got a sneak peek, of course, because you're Sandra.
Yeah. Well, lots of people got a sneak peek, I must say, but it was totally amazing.
Oh, awesome. Okay, well, I'm going to bring you live in just a moment. So, All right, here we go.
Sounds good.
For you. Interesting news.
It's Blake and Aaron's Spilling the Tea with Sandy.
K-Man's top news headlines of the day from CMR.
All right. Good morning, Sandy.
Good morning. How are you?
Fantastic. Nice. Hopefully everyone had a nice 3-day weekend, and I'm sure you were at a lot of festivities.
Yes, we had a fantastic time.
Great. We were talking about the drone show. That was pretty cool.
Yes. We saw it on Saturday at the event at Pedro that kicked off the Emancipation Day celebrations. Well, actually, it was kicked off on Friday with the 345 Day, but Saturday was pretty cool at Pedro Castle. They had the reading of the proclamation and a few other things. So that was fantastic. And we got to see it, and I was just blown away. It was pretty cool. So for people who haven't seen it, we will show it this morning on air, so that everybody has an opportunity. But we posted it on social media already. It's phenomenal. It was really awesome.
Yeah. That's
and
cool.
It's pretty cool seeing them set it up, because I drove by. They actually set up at the park next to Pedro. And I don't even know in total how many drones they had, but I think it was like probably 600 or 700 drones. Like, it was just phenomenal. Yeah. I don't even know how you control all those drones at one time. It was just really something to be seen.
That's awesome. I love it.
So over the weekend, we had a pretty active weekend. We did have on Friday night going into Saturday morning, a drive-by shooting incident on Eastern Avenue in the proximity of Bananas again. And so, oh my gosh, it's ridiculous. But anyway, this is where those guys hang out, and I guess they know each other, and they know that's where they hang out. So anyway, that happened, and the police were immediately on top of that situation, trying to de-escalate it. And then what is most interesting is the person who might have been the target or might have been shot at decided to take to social media and actually post a video of his own, which was very interesting. So let's just say that I'm pretty sure the police had a very, very busy weekend.
Wow. Okay. So he went to social. So did he not go to the police or just went to social media first?
Yeah. Well, no, just go to social media because now it's a tit for tat and, making threats between each other and all sorts of stuff. But he probably didn't do himself any favors with the videos that he made.
Wow. Interesting.
Very bold, though. Very bold.
Yeah.
So in other news, there's been quite a bit happening regionally that we really, really have to keep an eye on. One of them is that bomb threats across airports in the British Overseas Territories were made in several different jurisdictions. So everybody is kind of on high alert. But we're talking about airports in Bermuda, Tortola, Anguilla, all affected Sunday and Monday morning after these facilities reportedly received messages of bomb threats. There are also reports that the email was sent to the Cayman Islands as well.
Oh, sounds like an email.
Well, these things have to be taken seriously, though.
Well, obviously, but yeah, throughout that sounds like someone, maybe, I don't know. I don't want to say it's a kid, but someone messing around. And
well, it says that the British Overseas Territories have been the target of the persons behind the email messages. And, you can't take these things lightly.
Yeah, you don't say bomb on an airplane.
Or even in an email to an authority like an airport authority.
No, not
so the Cayman authorities haven't actually said anything about this at all. The others have issued various statements and, they're obviously very, very concerned. The Cayman Islands police did report over the weekend that there was some sort of a hoax. I mean, they kind of said, we received a phishing email from this like Russian email address. It kind of suggested that it was a bomb hoax for the Cayman Islands national carrier, but they didn't really go into too many details. But we suspect it's all interconnected. BVI, again, their international airport was abruptly closed on Sunday due to the bomb threat. Their airport's authority stated that it resumed normal operations 7:30 p.m. on Sunday, May the 5th. So everyone is taking it seriously. Like I said, Cayman hasn't directly said anything, but we'll certainly keep an eye out on that situation and advise if anything happens. I mean, this is a pretty busy weekend and week in general. The police continued to be busy. So they say that a plainclothes officer actually intercepted and prevented a violent attack just before midnight on Sunday, May the 5th. Reports from the RCIPS say that right around 12:15 a.m., police officers in plainclothes were on foot patrol in the area of Seafarers Way and Cardinal Avenue in Georgetown when they were alerted to disturbance taking place in the area. Upon further investigation, they realized that a man was seen with a machete in motion, and he was about to assault another man at the location. So they immediately identified themselves. And in an effort to prevent loss of life, one of the officers challenged the man armed with the machete using his service weapon. Wow.
Okay.
So he eventually complied with the instructions of the officer who instructed him to discharge his machete.
And was he arrested?
Of course.
Okay, good. You never know here.
Arrested on suspicion of being in possession of a restricted weapon and other offenses related to the incident.
Yeah, well, if they saw it with their own eyes, that should be pretty open.
I know. That's hopefully. I mean, hopefully DPP gets it right. But anywho, in other policing news, they're investigating another incident that happened Saturday in West Bay off of Birch Tree Hill Road, where a man was stabbed in the abdomen after an altercation in that neighborhood. So once again, police say that they attended the scene, met with one of the parties involved, and realized that the man had a single stab wound to the abdomen. Informed the police that he was involved in an altercation with someone obviously known to him, which resulted in him sustaining the injury. So that party had already left the location. The injured man was transported to the hospital by ambulance and treated for serious but non-life-threatening injuries. So they say they're continuing to investigate that one.
All righty then.
One more. Let's do it. Let's do a feel-good story.
I was going to say, do we have something good out there?
I know. It was a rough weekend.
Yeah.
The police were very, very busy, I must say. Let me see. Why don't we celebrate Emancipation Day again? The celebrations do continue, by the way, for, they're going to do a turtle release. There's a number of events going right straight through until next weekend, including Cayman Brac celebrating it. So please go check out the schedule of events. You'll find it available on social media and other places. And yeah, it's good to celebrate and know your culture and your heritage and all that great stuff.
Absolutely.
Yeah.
All right. Well,
so we're off to a running start this week.
Yep.
Lots of exciting things in the works this week as well, including the opening of the Indigo Hotel.
Oh yeah, that's right. That's crazy. That's already finished. Roads haven't even been completed as fast as that got done.
It is pretty crazy. It is.
Yeah. All right, cool. Well, then we'll see you tomorrow morning for the Wednesday show, which is
sounds good.
All right. Have a great one. Bye.
Have a good one. Bye. All right. Good morning. Good morning, everyone. Hope you guys are doing well. I think we're waiting on one more guest to pop on, and then we are going to get started because it is Tuesday. And y'all know what that means, honey child. That means it's Medical Rundown Tuesday. All right. Everybody's good today? Let me just have a quick look-see. We got an exclusive this morning. I think a lot of you are going to be probably as shocked as I am about this exclusive video. Or maybe even more shocked and surprised than I am. So we will be getting to the nooks and cranny of all that here in just a little bit this morning as well. All right, so let's do roll call. Good morning, everyone. We got people. Oh, Alexa's always claiming something went wrong. All right, give me one quick second, then we're going to do roll call, and then I think our guest should be ready by then. All righty. Good morning. I see Dr. Archita is ready. Everybody's ready. All right, let's get it this morning. So we're going to be talking this morning about asthma in recognition of World Asthma Day. So we have, let's go ahead and introduce our guests. So we have Dr. Harsha, who's in charge of critical care. He's a consultant pulmonologist at Health City, Cayman Islands. Good morning, Doc. How are you?
Hi, good morning. I'm good, Sandra. Thank you. How are you doing?
Yes, I'm doing well. So nice to see you again. And of course, I don't think you need any introduction at this stage. You've been on the program quite a few times already. And we're going to be talking about this really, really important topic of asthma, something that a lot of people suffer from. And so we're going to get all of the details on this. We also have joining us this morning, Dr. Archita. She's also a consultant pulmonology, sleep and medicine as well expert. So good morning, Dr. Archita. How are you?
Good morning, Sandra. Thank you. I'm fine. And thanks for having us on the show again. Morning.
Yes. Yeah, so good to have you here. So we have these days, we've got World Asthma Day that really allows us to focus on this condition that affects a lot of people. It is May the 7th, which is today, is World Asthma Day. And if you have someone, if you suffer from it yourself, or you have a child or somebody else that suffers from it, you'll know why this is such an important topic. So let's go ahead and talk a little bit about what asthma is exactly.
Harsha?
Yeah. Okay. I to start with, today is World Asthma Day.
Mm-hmm.
So the GINA is the forum where they make guidelines, and it is an initiative. GINA is Global Initiative for Asthma. So they are the one who conduct this Asthma Day. So the idea is to give information and make aware about the disease. So why this initiative is made is because asthma is so common and prevalent around 260 million population. They are affected with asthma, and I was just seeing the trends it was about 6.5% of all the age group in around 2010, and now it is almost like uh, 8%, but dramatically it reduced after 2020. Do not know if it is the effect of COVID or if it is not reported. Again,
Mm-hmm.
it came down to 6.5%. So asthma is affecting a lot of people in the world. So everyone needs to know about the disease which they are suffering. So that is why this World Asthma Day. So coming to the disease itself, asthma is a disease where it affects the airway passage, I would say. So airway passage, why I'm saying is because
Mm-hmm.
it starts from the nose. So usually the symptom, there are different phenotypes and different variants of asthma, but still typically when we are saying asthma, usually we say we refer for a uh, atopic one. Atopic one means like typically they have these allergic symptoms where they have this hypersensitive reaction, that is rashes on the skin, excessive watering of the eyes, recurrent running nose or sneezing, when particularly when they're exposed to the triggering agents like dust or like or maybe the dandruff, pet animal dandruff, or the molds. So these are the usually triggering agents. There can be food products also. So depending on the triggering agents, usually they may have recurrent sneezing,
Mm-hmm.
which can lead to have increased bronchospasm, and usually they present as chest tightness or wheeze, with or without cough, or increased shortness of breath, particularly if they already have an asthma. They
Mm-hmm.
usually have some symptoms of shortness of breath, and they can we say it as asthma attacks. During the attacks, the symptoms will exacerbate, and usually it is relieved by the inhalers, if at all they are taking the inhalers. So typically this is how I would define asthma.
Mm-hmm. Mm-hmm. And is it something that, I think a lot of us who have heard about, people who suffer from asthma know a little bit about it, but we probably don't have a full understanding because it's a condition that you can be born with. Is that right, Dr. Archita?
That's right. So I think Harshat's already explained it's a chronic inflammatory condition and there can be many predispositions.
Mm-hmm.
So I always say asthma is one of the most unpredictable diseases that one can have. So you can have childhood onset asthma, which starts very early in life. Some children can be born with it.
Mm-hmm.
And most of these individuals will have some predisposition genetically, whether they have a strong family history or multiple family members have atopies and allergies. It can also manifest later in life, which we know as adult onset asthma. And the type of inflammatory cells we see in these individuals may be different. So, or the mechanism of the inflammation that causes asthma. So, yes, to answer your question, Sandra, yes, it can be present from early childhood.
Mm-hmm. And then what causes it? Do we have any idea of why for some people you see it start at a very, very early age, and then for other people it's something that can develop even later on in life?
So, asthma is a broad term, like we just mentioned, and it has now we've come to recognize that there is not just one type of inflammation.
Mm,
Previously, the belief was that all asthmatics have atopies and allergies, and it's triggered by a certain mechanism that, this is it, and that's what asthma is all about.
mhm,
However, with time, we've come to realize that asthma is a chronic inflammation of the airways,
mhm,
chronic or recurrent, and it can be variable. It changes with time, but this is a disease spectrum. It's not just one cause, and there can be multiple types of inflammation that can take place in the airway, which can then trigger the same symptoms which asthma presents with: chest tightness, wheezing, coughing. So
mhm,
the risk factors or the presentations can vary because of the type of inflammation. And as Harsha's mentioned, in childhood and early onset asthma, usually it's atopies or allergies, which are usually associated with some kind of hay fever, atopic eczemas, where you see young children having this, usually a very strong genetic predisposition. There
mhm,
is also a risk factor of exacerbating or developing asthma later in life with exposure to certain types of irritants or allergens, especially molds, certain types of chemicals and dusts. Smoking can predispose people to develop asthma as well, or at least trigger a tendency to develop asthma if they already had a genetic predisposition. So there can be many triggers later in life. We also know in adult onset asthma, there's been some association with acid reflux. There have been associations, the type of inflammatory cells may be different in their airways, and they may not respond very well to standard asthma therapies. So it's a wide spectrum. I would like to say that asthma is basically a conundrum or a set of conditions which affect the airways, which leads to acute and usually reversible and recurrent airway inflammation.
Right. Okay. So World Asthma Day being organized by the Global Initiative for Asthma, GINA, and it's held annually in May to raise awareness, my apologies, of asthma worldwide. The theme this year is Asthma Education Empowers. Speaking of, empowering through knowledge and information, how many patients would you say, that like a percentage of patients that come to you that don't quite understand their asthma diagnosis or how to, get it under control and keep it under control?
Several, I would say, but Arsha, I'll let you answer that.
Yeah, so this year's theme is asthma education empowers. This is kept because the like usually people get confused because of the common symptoms. I would say why, because most of the respiratory illnesses, they have common symptom, that is shortness of breath, cough, and usually chest pain, or maybe they confuse the chest tightness with chest pain. So I feel because of the common symptoms, they tend to get confused with what they have. So that is the most common misunderstanding, I would say, because the same symptom lead to different diseases, I would say. So that is why it is very important to make them understand what asthma is. And I would say, like, typically the asthma would have this chest tightness, wheeze. Usually these are the two typical symptoms, usually triggered by any aggravating factor. So usually these are the three typical symptoms, but most of them they doesn't know. And why we are trying to empower them with the knowledge of the disease. Why? Because most of the time, first of all, if it is not accurately diagnosed, or if they are not informed very well about the disease, they tend to have a poor compliance with the treatment as well. They might not follow the instructions. And most of the time they should know what the disease is. Why? Because if they know that, okay, this is the triggering factor which is leading to the exacerbation, then they can avoid the triggering factors most of the time. And most of the time, other thing is, like, they would be working in an environment which will lead to the symptoms, and they will never know if that is causing the symptoms, or if that is aggravating the disease or increasing the disease. And the other thing is that whenever they are diagnosed with the disease, usually they were given inhalers. And one thing is also, like, people are not very what was I would say, maybe they will have a myth or like some misunderstanding about the inhaler. That is, they think that, okay, once if I take the inhaler, I will be taking the inhaler lifelong, or like maybe it is like an addictive substance where I need to use it quite often. This is the most common misunderstanding, so that we need to make them aware that it is not an addictive substance. And
Right.
one more thing is that once they were given some inhaler, like suppose if a patient had this asthma attack some 2 years or 5 years before, and they were given an inhaler, what they do is usually they keep with them, and they do not know what type of inhaler it is, because there are several combinations of inhaler. Like usually we can give a bronchodilator, we can add steroid, So these are the most commonly used inhaled steroid, inhaled medications. But usually when they are, and in that also we have short acting ones and long acting ones. Like
Mhm.
usually a short acting one is given or prescribed when they have an attack. But what they do is they continue to use that inhaler all the time,
Mhm.
so which is not supposed to be done, and they will never go to a doctor because they think that anyway doctor will give this, so we can
Uh-huh.
take ourselves. So that is how the adverse effect can also increase, because it can
Mhm.
have a effect on the heart as well, and also uh, it can have other effects, like they might develop tremors, and uh, these are the common side effects. So they should be made aware of the side effects. And
Mhm.
one more thing is that, like, they should be taught how to use the inhaler. That is very, very important, because most
Mhm.
of the time they would not be using the inhaler appropriately, and they think that the inhaler is not working. If we do not check if they're using the inhaler properly, then we tend to increase the dose or change the drug, which anyway which will not affect, and again they will have a poor compliance. So that is why it is very important to tell them how to use the inhaler, and
Mhm.
tell them how to know what is happening with the disease, how to know about the triggering factors, and also to know that alarming symptoms or the red flags when they have to approach their pulmonologist or the physician. So
Mhm.
these are the things, common things, and commonly it is
Yes.
lurking in the patient. So this we need to inform.
So
I mean,
let me just pause
patients
you.
at the time
Yes,
of
let me just
diagnosis.
pause you right there. So what I'm
Yeah,
hearing you say, just to be very, very clear, is there's a couple areas of misinformation that is really, really significant. So one of those is people thinking that they will become addictive to the inhaler. So that might really impact their usage of it. And then also, in addition to that, improper use of the inhaler is really, really one of those critical areas as well. As opposed to just telling people how to use an inhaler, do you demonstrate how to use it? Because I got to be honest with you, I have had to, like, if you have a bronchial episode, like you've had a really bad, um, like flu, cold, whatever, sometimes they give you, I think, like an inhaler to help with the breathing. And they kind of give you these instructions. And I've always looked at them going, I don't really know what that means. Like, I need a demonstration. I need a visual. So I've gone to YouTube and try to look at YouTube videos and how to use it. Do you find that actually demonstrating and showing people how to properly use an inhaler, as opposed to just telling them, is a better option for them to learn, especially if it's something they use quite often, for them to learn proper inhaler use?
yeah.
Always.
We used to demonstrate, or
Yeah.
usually we keep the like placebo, like
Mhm.
where we have the devices and we usually teach them. So that is what is to be done. But I don't think that everywhere they do this. That is why they have to be demonstrated when we prescribe them an inhaler. Yeah.
Yeah. Dr. Archita?
Yes, so I this is usual practice, Sandra. So the first thing is, if you don't educate your patient, the patient is going to be non-compliant. Because unfortunately, I have noticed that a lot of asthmatics, either they are overconfident about their condition, or they've just accepted the fact that they're going to be short of breath and they have asthma. Anything they have, oh, I have asthma. So this is a very unfortunate fact. And the first thing we need to tell people is asthma is a reversible and a controllable condition. They don't have to live with it. They don't have to live with a sense of doom. They need to know how to control it. And to control it, compliance to medications is important. They also need to be told the difference between oral medications and inhaled medications first, to accept inhaler therapy, to say,
Mhm.
well, it's lesser dose, more effectively given directly to the airways. It's not an addictive substance. A lot of my smoker friends, who also have asthma, who present with COPD, they say, I don't want to be inhaling a medication. Like, if you can
Mhm.
inhale a toxin, you can inhale a medication, right? So we have to make them understand it's not addictive, it's not tobacco smoke, it's not THC vape, it's a medication given to you directly in the airways to reduce what is happening within the airways, and that is inflammation. The result of the inflammation is the tightness, or what we know as bronchoconstriction. And most people, like Harsha already mentioned, only keep taking symptomatic treatment for that bronchoconstriction. We're taking inhalers like Ventolin or salbutamol, which they
Mhm,
feel is their treatment, and that's all they need to do. But
mhm,
that's not taking care of inflammation. So first, education. I
mhm,
usually use certain tools to show them or draw a picture and make people understand what they're dealing with, and then tell them how to effectively treat it.
mhm,
And doing this over and over again with some of the patients, so they need repeated counseling sessions. Some are very wise and they think, like I said, can be overconfident and feel they can control or manage their asthma. They know what to do. But
mhm,
just giving them this basic information, having what Harsha described as placebos or tools within the office where you can show them how to use it. And
mhm,
for example, I mean, asthma therapy can vary depending on the type of inhaler or medication you're giving them. The
mhm,
formulations change, the way they're inhaled changes. And for some reason, if you don't have that device within your office or within an easy reach, using, just watching a YouTube video with them or showing them, how you would do it makes a huge difference to patient compliance and adherence. So I
mhm,
think that time spent is a time well spent with the patient during counseling sessions where we do educate them how to use the inhalers well.
mhm.
Yeah.
Very
And
good.
why they need to take it and how they need to take it and any special instructions around it. What are the side effects to expect? Or what are the benefits to be expected? How long would it take for their inhaler to kick in so that they don't start feeling it doesn't help? Right?
Mhm. Yes. Okay, so some causes of asthma. Someone actually commented on WhatsApp. They say I use a spacer with my
Mm-hmm.
inhalers as well. What's a spacer?
Space is nothing but a device which we connect to a meter dose inhaler, which is
Mhm,
based on an aerosol technique, and the spacer allows the medication to be held for a little while to allow coordination in people who may not be able to coordinate well, or who tend to cough immediately after they, take inhalers, or just to make sure that the delivery of the medication within the airways is improved or better as compared to taking it directly in their mouth.
Oh, I see. Interesting. All right. So, some of the causes of asthma, family history. If one or both parents are asthmatic, you're 3 to 6 times more likely to develop asthma. So, that's interesting.
Mhm.
Existing allergies or conditions like atopic eczema and hay fever. Huh, this is interesting. And early childhood viral respiratory infections can lead to asthma later on in life.
True.
Yeah.
So can obesity, so can exposures. I think Harsha will talk about it.
Yes. Mhm. Dr. Harsha?
Yeah, okay. I think there was some network issues, I think.
Mhm,
Yeah, definitely. Like these are the causes, but the thing is, so the understanding of asthma has changed over the time. This is like the causes which you have mentioned is like what happens in a typical asthma,
mhm,
where usually there is a family history. So and also usually there is an atopic history. So
mhm,
so these are the common presentations, I would say. So but definitely, so when we have to understand asthma, we should know that it usually happens because of the varied immune response from the body. So the body has a defense mechanism where it will respond by throwing the chemicals, I would say, or like inflammatory markers, which usually we get it out of blood. So that I would say as inflammatory markers. Otherwise, body has a varied defense mechanism to fight the foreign bodies. So like these triggering agents are the foreign objects which we tend to inhale. So based on this, so but definitely this is not the I mean, this is not what happens in all the variants of asthma, because there are already, it is discussed, like it can have different phenotypes where they need not have this atopic symptoms. They can just develop a shortness of breath, or like
mhm,
it can be smoking related. Like whenever they are smokers, it can present then. And sometimes someone someone who is obese, where there may not be eosinophils, but still they may have symptoms. And there are patients where we call them as frequent exacerbators. But like the see, there is usually T1 and T2 response in the immune response system. So when there is, usually we thought that it is a T2 response, but nowadays we say that even with the T1 response, so they can have this asthma symptoms. I know that it is more of technical thing, I think.
I think yes. To
But
simplify
mainly
it, the
it is
type
like
of
there are
inflammation
two
can be
parts.
different.
Yeah, there are two
Yes.
parts. So depending on the parts they pick, the presentation will also vary. So that is how I would say the so it why I am telling this is asthma is not as simple as like before. I would say earlier we would say that usually the symptoms will have start in the childhood, and that is when we say it as asthma, because usually we compare this with COPD, which is also one of the common diseases. So now there is a lot of overlap between these two, and also there is varied presentation. So that is why I mean understanding asthma will also, it also has become little complicated, I would say.
Hmm.
So
Yeah.
that is why we should know
Because,
more about it, I think.
yeah. And I mean, again, going back to the theme for this year of knowledge being empowering, it's important to recognize that as we make these advances in medicine, even the professionals know more about what's going on and they understand more, which allows them to understand more about treatment and diagnosis and, how to live a much fuller and much more meaningful life with a condition like asthma. So, like they say, the more you know is always
Yeah.
better. So I
So
see
the
obesity here in the list as well.
Yeah. Very quickly, Sandra,
Yeah.
the crux of the whole thing that we just discussed about asthma endotypes and asthma phenotypes, it's how it presents, when it presents, and what types of cells are causing the inflammation.
Mhm.
But the important point to note here is asthma is commonly treated by a lot of physicians, including your general practitioners, including, sometimes self-treatment by patients when they can, unfortunately, they can buy, quick acting inhalers over the counter in some parts of the world, including on our island. And
Mhm.
so if you think that you're managing your asthma well, but yet you need to take your inhaler, 3 to 4 times a day, or at least once or twice a day, or you have nighttime symptoms where you wake up with chest tightness or shortness of breath at least 2 or 3
Mhm.
nights in a week, or you have frequent flare ups which require you to get nebulizations or go to your GP clinic or to an emergency room, it does not indicate good asthma control. So for people
Mhm.
who are asthmatics, they accept it as a norm. This is not normal. And if you are having what we know as persistent asthma with frequent flare-ups, it's a good idea to see a specialist. So because it's not as simple as you take an inhaler and your asthma will go away, or you take a nebulization and your asthma may go away. There are things we need to ascertain. We need to find out the severity of the asthma by doing breathing tests, perhaps, or by doing certain blood tests, which will be indicative of the type of inflammation, and then tailor therapy according to the type of inflammation.
Mhm.
So it's
Mhm.
always a good idea to reach out to a specialist. We are not trying to confuse everybody here with a lot of technical jargon, but that's the crux. It's not as simple as take an inhale and the asthma's gone.
Mhm. Very good. All right.
One more interesting
Yeah.
thing I just wanted to mention, like there is an interesting hypothesis called hygiene hypothesis, because we are talking about the cause. I thought of this. So that means like asthma is more prevalent in someone who is more hygienic during the childhood, particularly, that like they should be allowed to, like they it was an interesting study.
Mhm.
Children who are brought up in an environment like a village environment where they
Mhm.
are exposed to this like moles and like cow dung, like
Mhm.
they interestingly they saw that they have a less tendency to develop asthma
Hmm.
during their adulthood. So that was the
Really?
outcome,
They,
yeah. And also those who were given more antibiotics
Uh-huh.
during the childhood, they tend to develop more asthma symptoms. So
Huh.
this is very interesting, like that is why I would say, like
Uh-huh.
whenever we are like, because we think that like we should be very high. I am
Mhm.
not anything against being hygienic or anything, so
Yes.
everything should be exposed in a moderate way, I think, that
Hmm.
is very
Very interesting.
interesting. Yeah.
So
Yeah.
basically, it's about antigen exposure in early life. If you've
Yes.
been
Yeah.
exposed to a lot of variety of things, including dust
Antigens.
and dirt and, certain
Yeah.
germs as a child, and not been in an super clean environment, the
Yeah.
likelihood that you will develop an optimal immune response to these things is good. Because later then in life, this may develop into something you manifest an extreme response to and develop
Right.
asthma. That was the hypothesis, and this is a strong understanding. But
Yes.
yeah, doesn't mean people have to be dirty or keep their houses dirty or allow
Yeah.
their children to eat dust. Dirt.
Yeah.
But this is
But
just an
there's
example. Let
something.
your child play.
Yeah. There's
Let your
something to
child
be
get a
said
little
for
dirty
it.
and gets his hands on. Breastfeeding is a
Yeah.
good idea. So a lot of things, allow early antigen exposure.
Right, right, right. Yes. I think that's true of a lot of like allergies and stuff because I've even heard like people who have, allergies to nuts and
True.
whatever. What they're finding is if those children early on were exposed to those things, they're less likely
Yeah.
to develop allergies and stuff. So very,
True.
very
That's
interesting.
exactly what he meant. So that's how our
Yes.
immune response develops in life. Yes.
Yeah. And I got to tell you one, this is kind of icky, so as parents, sometimes your children do stuff. We're like, like that's so nasty. But, I read something similar when Dr. Harsha was talking about this. I read something similar about picking your nose as a kid and how that has certain benefits, apparently. I think it's every parent's worst nightmare when they see their little ones picking their noses. But there's, again, science to prove that apparently picking your nose and the other fun stuff that they like to do with it will help
We
them
didn't say
to
that.
will help them to be more robust. Let's put it that way. Thank God it doesn't last forever. Okay, Inspiring has a question and comment. Inspiring says that stress can trigger asthma symptoms or exasperate existing ones. Studies have shown that stressful life events or chronic stress can lead to increased asthma symptoms and decreased lung function. So probably like most things
Very
in
true.
life, stress is not good for you. Inspiring has a question. Are there any other conditions or comorbidities associated with my asthma that he or she, I don't know if Inspiring is a male or female, has to be aware of? So, what other conditions or comorbidities associated with asthma that you should be careful of if you have asthma?
Well, plenty. One, of
Yeah.
course, depending on what type of asthma you have. Again, it brings us down to the whole scenario, and not one advice will fit all. But generally,
Mm-hmm.
especially in people with adult onset asthma, obesity, acid
Mm-hmm.
reflux, poor sleep quality, stressful life. You're not getting enough sleep, or you're not, getting enough exercise, or don't have a balanced diet, or you're going through life stresses, a lot of anxiety.
Mm-hmm.
Uh, these can all be triggers for asthma or contributory factors to having poorly controlled asthma. Also, other conditions which deprive you of, a good rest or sleep, smoking, exposure to environmental smoke of any sort,
Mm-hmm.
if you're a secondhand smoker. Also, exposure to certain chemicals, strong perfumes or sprays in the room, fragrances which are very strong, can be triggers for asthma and
Mm-hmm.
should be avoided. Comorbidities, mostly, I mean, we've already talked about asthma, obesity, sleep apnea are comorbidities that one should be careful about. Some people have aspirin-induced asthma, and if they pop an aspirin or take a lot of painkillers, they have to be careful about it. So, comorbidities can be different for different people. We can't give you a general spectrum, but these are definitely something to avoid or
Mm-hmm.
watch out for if you are asthmatic. Taking over the counter painkillers for your arthritis, or allowing yourself to put on more weight, or continuing to smoke.
Mm-hmm.
Bad ideas.
Wow. And so I can imagine that the issue with weight would be that, weight sort of reduces your lung function from being optimal. Same thing with lack of exercise. If you're not getting enough exercise to kind of, your lungs are a muscle, I guess, not like traditional muscles, but it's like anything else, the heart or anything else. If you're not using it in an optimal way and you're damaging it, then there are negative effects to that.
Uh, yeah, like definitely, like lung has muscles. It's like it is has a different components. Like
Mhm.
lung has tubes, so the tubes are surrounded by the muzzle bands, I would say. It's not like typically like a muzzle which we see, the
Yes.
arm muzzles. So they are the thin layers of muzzle straps which surround the
Mm-hmm.
airway tubes. So these muscles are more prominent in the larger airways than the smaller airways. That is why when there is an asthma attack, usually they have this chest tightness because these muscles tend to contract and it is kind of like squeeze the airway tubes. So this is typically called as asthma attack.
Mm-hmm.
So definitely like someone has an asthma, so they will have this symptoms. And the other thing I wanted to say is just I am repeating the same thing, like this obesity and lack of sleep and reflux. So these, I would say, the it's a cycle or the common comorbidities.
Mm-hmm.
So this typically it is a vicious cycle. Like someone who is not sleeping will have increased stress levels. So increased stress level, they have increased reflux disease and increased asthma symptoms. And also because someone who has a chronic asthma, they tend to, I mean, like the diaphragm usually it laxes because of the changed anatomy over the time.
Mm-hmm.
So that is why the sphincter tend to open, the stomach sphincter. So
Mm-hmm.
asthma can lead to reflux can lead to asthma. So both are, this is the most common comorbidity, I would say. Yeah, just
Mm-hmm.
I want to add to that. Yeah,
And
because
Right.
it
this
can
is
be
the
an
most
asthma
common
mimic, if I may add
presentation.
to it. A lot of people feel their asthma is not controlled, but it's because of other conditions which are mimicking the
Yeah, that
asthma.
is true. Usually, maybe they have a reflux, but they think they have this asthma all the time. Yeah.
Mm-hmm. Mm-hmm. Wow. So interesting how everything is just interconnected. So
Yeah.
smoking obviously seems like a no-brainer if you have any kind of respiratory issues. The last thing you'd want to do is smoke, but not just you smoking and vaping, but also exposure to secondhand smoke, which could be traditional smoking as well as things like you don't want to hang out at the jerk stand for too long if you're asthmatic, right?
True.
Mm-hmm.
So any smoke,
Any
whether
smoke at
indoor or outdoor smoke exposure, any strong smells or perfumes or chemicals, including household bleaches or in a concentrated manner, or
all.
room sprays sometimes can be triggers. Not everybody is triggered, not all asthmatics are triggered by these, but definitely these are likely to trigger airway irritation and inflammation, which
Mm-hmm.
results in bronchoconstriction or tightness in the breathing tubes.
Right.
And to answer your previous questions, unfortunately, we say everything is time is muscle, but in asthma, it's only the smooth muscles in the airways that we're worried about.
Okay.
Lungs do not have muscles.
Yeah. Yeah.
Okay.
Okay, very good. All right, so some symptoms that people should be aware of. Let's just go through the list of symptoms so that they can, be on the lookout for this, just in case, they've never had a proper diagnosis and they're thinking, how do I know? Is this asthma? Is this just a lingering cold or flu that I've had for a couple months? Is it something more serious? So we have everything from shortness of breath and difficulty breathing, and trouble sleeping caused by coughing, shortness of breath, or wheezing. Wheezing. Can you explain for us what wheezing is? I think most of us kind of have a layman's idea, but can we get a proper definition of what you'd consider a wheeze?
There, yes, and I think that's very important because a lot of people tell me they're wheezing, whereas what they're having is a stuffy nose. So, wheezing is basically a fine whistling sound. Some people also describing like a cat purring within their chest. So it's a fine whistling sound which is audible to
Mhm,
you or to somebody next to you, especially when you're breathing out. Yeah, and that's typically a wheeze. It can be brought on with exertion. It may be worse when you develop a cold or you're a little congested. But if you hear yourself wheezing or a whistling sound in your chest or in your
mhm,
upper part of your, in the neck, that may be indicative of airway bronchoconstriction.
mhm. Someone says it's almost like you sound like a cat.
Hmm. Like a cat purring, like I just said.
Yes. Okay. I don't have cats around me, so
Or
but
fine whistle. Yeah, I mean,
yeah.
so
Chest,
whatever your experience may tell you.
yeah. Chest tightness or pain, coughing, often worse at night, coughing or wheezing again, worsened by respiratory viruses, and then stress, sinus infections, pollen, cold, and dry air, acid reflux, physical exercise, and fragrances. All some of the symptoms as well. So, very, very interesting. One of these made me pause. So, if you see, for example, that you're getting frequent sinus infections or respiratory viruses, is that an indication that maybe you might want to, come in and see a pulmonologist to kind of figure out if something else more serious is happening?
That is true. It's a
Mhm,
good idea to assess yourself, especially with lung function testing, if you are having repeated flare-ups or what people describe as bronchitis.
mhm,
And there might be an underlying airway disease, which is
mhm.
diagnosed or undiagnosed, and it's always a good idea to get it checked out.
Yes.
Yeah, like because it is like as I told you in the beginning, so the airway starts from the nose till the alveoli, which is the
Air
last
sacs.
part of the air. This is like a whole air sac. So
Mhm,
anyway, there is an inflammation. It can also lead to inflammation in other part of the
mhm,
lining. So usually someone with allergy can have only the nasal symptoms, which we say it as allergic rhinitis.
mhm,
But if it is not treated adequately, or if someone is getting like someone is having a sinus, means that he has a constant inflammation of the upper respiratory airway. If it is not treated adequately, so they have get this frequent recurrent colds, which can lead to the airway inflammation down. So that is, we say it as usually we call it as
mhm,
allergic march, like it starts from the nose and goes down to the airways. So that is why treating recurrent cold infections or recurrent viral cold flus is very important.
mhm.
We already know that someone having a recurrent viral infection can also lead to asthma disease. Yeah.
Mm. Right. So let me just ask you a question. Lately, I've been suffering with like allergies and stuff. I really shouldn't say lately because over the last number of years, I've kind of seen flare ups, right? That I didn't have sort of when I was younger. When I went to the ENT, one of the things that he said is he's recommended like the daily saline rinse. Is that something that people who are asthmatic can also use? Is it beneficial to do something like that for them also?
I think that depends on the symptoms. Like
Mhm,
someone having may or may not have sinus or nasal symptoms.
mhm,
But usually, typically, if someone having a nasal symptom
mhm.
and then leading to asthma, definitely, if they are keeping their nasal congestion in control, will definitely control their asthma symptoms. But at the same time, if someone doesn't have those symptoms, then there is no point. So it
Right.
depends on how they present. Yeah.
I see. Okay.
So if you have nasal congestion, doing sinus rinses is a very good idea. And
Yeah.
if you have concomitant asthma, it will help control it for sure.
Mhm,
I mean, in the sense, improve your quality of life and help frequent exacerbations. However, just for asthma, it's not curative, obviously,
mhm.
just like Harsha said.
Yes. Yeah. Okay. Very good. All right. So, inspiring. Thank you for clarifying. He says, I'm a male, Auntie Sandy. Thank you, inspiring. He says, what are the benefits and potential side effects of each medication? So, we're going to talk now about some of the asthma treatments. Number one, avoid common triggers. So, if you know smoke and all these other things trigger an episode, then obviously you want to ensure that you make your condition worse. You want to ensure that you try to control your environment as much as possible.
True. So
Yeah.
asthma is really one condition where prevention is better than cure if you
Hmm.
can prevent it.
Yes. Yeah.
So if you have you know what your triggers are, you can avoid them. If you know you're
Mhm.
allergic to your cat, well, you have to do something about
Get
it.
rid of the cat.
So if you know you're allergic to something, avoid it. If there are certain foods that trigger it, or but
Yeah.
sometimes you have what we know as perennial allergens or things you cannot avoid. They're always present around you.
Yes.
They're unavoidable or they're unpredictable, and in
Mhm.
that case, you need to control it. Yeah.
Mhm.
And depending again on the type of asthma you have, whether it's just intermittent or whether it's a persistent asthma, whether it's mild, moderate, or severe,
Mhm.
your treatment may change. I'll let Harsha elaborate on it, but that's the basic basic understanding. So we can't talk about each individual treatment that probably requires a consultation, but we can give you a broad overview.
Yeah,
Yes.
as I told in the beginning, so the main this time the theme is to empower them with the education. So this is one of the, I mean, two important things. First of all, they should know that they should avoid from the triggering factors, because like most of them, they don't want to leave their pets, but still they want to control asthma. That is invariably, I think it is not possible. So that is one thing. They should definitely try to identify the triggering factors and try to avoid. That is the best way of treating asthma, I would say. It's not like that is one of the treatment, I would say. And also the other thing is to know about their inhaler. And also they have this myth, or sometimes even the physicians would not be aware of this. So they would say that try and avoid steroid inhalers as much as possible. But the thing is, the whole idea of this is to reduce the inflammation. So steroid is the best medicine which we can use, and we should always. I mean, it is already explained. Dr. Achita told you that the idea of giving an inhaled steroid is that it is more effective because it is directly reaching the lung, and it has a less or minimal side effects because it is not reaching the blood. Only a minimal micro, we are giving in micrograms, and only micro levels of that will reach the blood. That means that they should not have any side effects, and these inhalers are meant to be used for mm, chronic usage. So that is how the trials are, and it has been proven time to time. And that is why they should understand that taking an inhaled steroid is not going to affect them, like, or it doesn't have a significant adverse effects, I would say. Yeah. So understanding the inhaler is the key for an asthma patient. Yeah.
So understanding the inhaler, how to take it, and when to take it, or how
Yeah.
regularly to take it, is the important part. So avoid a trigger if you know it. Take your long-term maintenance inhaler, or preventer as we call it, regularly if you have what we know as persistent asthma. Now, there has been a bit of change in paradigm recently where we say that, people who had intermittent asthma, which only flares up when they have a cold or a flu or a seasonal asthma, we used to, a lot of physicians, and even now, a lot of general practitioners will give them only a short-acting bronchodilator, like a Ventolin or a salbutamol or, albuterol. However, the change in paradigm now is to consider adding an anti-inflammatory at that point as well, because the whole idea behind asthma is that it's leading to airway inflammation. And an anti-inflammatory inhaler usually contains a steroid. Now, steroid, the word, minute you hear the word, like Harsha already mentioned, people are worried, they're apprehensive, they're thinking about side effect. But the most important thing I think he's already mentioned, and I'm going to just reiterate it, the amount of medication you get in an inhaler is in a few micrograms per dose. Even if you took, a few micrograms 2 times a day, only 20 to 30% will actually reach your airways, and from that, maybe a 60 to 70% may get absorbed into your bloodstream. So the dose you're getting effectively into your bloodstream is really minimal, and we don't really have to worry about the potential systemic side effects that, the like taking tablets of steroids or injections with steroids can do. Now, the whole idea behind, again, this education is so that people understand this. If they do not control their asthma by taking their maintenance steroid based inhalers, they end up having flares and, hospital visits or, doctor visits, and end up getting oral steroids. And the dose that they get with oral steroids is hundreds of times more, even if they take a short course of oral steroid. Even if it's for a 5-day course of oral steroids, the dose they may end up getting is maybe not, if not thousands, at least hundreds of times more than what they would take as a maintenance inhaler for 2 to 3 years. So, so that's the understanding. And plus, you've risked your life, you've risked your quality of life, you've ended up getting repeated flares and ending up in hospitals and emergency rooms. And the alternative was just taking your regular preventive inhaler regularly, with much better quality of life, much better exercise tolerance and effort tolerance,
Mm-hmm.
Much less side effects, less flare ups or exacerbations leading to hospital visits or emergency room visits. In short, better controlled asthma. So we need to see what are we looking at. You need to weigh your misconceptions versus the risks you're putting yourself through.
Mm-hmm. Hmm. All right, very, very good. So we have some comments here this morning. Evelyn, good morning, says, I'm asthmatic and all these things listed affects me. So I stay away from most of them, but I love fragrances. So is there anything she can do if she loves fragrances? Is there any compromise there?
If the fragrance doesn't flare up her symptoms, it's fine to use. Always use more toned down fragrances, nothing very strong or pungent, and use in moderation.
Mm-hmm.
But
Very
if
good.
that's your trigger, if that's not a trigger, well, enjoy your fragrance.
Mm-hmm. Very good. All right, Irvin, keep smelling nice. And is there a difference between like can you use more natural fragrances versus man-made, or it just really depends on any fragrance could potentially be an issue, and you just have to know your body.
Yes.
Yeah, that is true.
I think exactly. An individual will know what their trigger is, frankly
Yeah.
Yeah.
speaking. And I know asthmatics who can spray a room freshener around and be fine. And there are others who walk into a room with a room freshener or next to somebody who's worn a fragrance and they're in trouble. So
Yeah.
it is an individual thing. And you know
Right.
yourself better than anybody else.
Yes. Okay.
Yeah, usually, like, when someone is coming with these complaints, we usually do this sort of test, like, so usually the common allergens, like it can be the environmental allergens or the food allergens. Usually we send it, and then we'll know the common allergens, and based on that also there is a treatment called desensitization, which anyway we are not doing at Health City there. But that is also, it is only for common allergens. It is because there are millions of, like, what was millions of things which we are exposed to, and we cannot just mark every single thing that we inhale. So that individual is the best person to know what he's allergic to. So one has to be very observative and find it and avoid it.
Mm-hmm.
That is the best thing one can do.
Okay, very good. Soka says that my son was in and out of the hospitals with asthma as a child. A couple of nurses approached me to say that his doctor was over medicating him. When they mentioned this to the doctor, he told them to do as he said. Another doctor came to me and told me to take my son home, and anytime he felt he was having an asthma attack, to drink hot coffee or tea, as it was the steam that was opening the airwaves. He's now 31 years old and has never been back to the hospital, drinks hot tea daily. So, can we talk about what happened? I mean, obviously, this was a while ago, but seems like she did not have a good experience back in the day with her physician.
I think this is again a problem with misconception, especially also among the medical community. A lot of people feel treating asthma is unnecessary and people will grow out of it eventually. I'm
Mm-hmm,
not saying that children don't grow out of asthma, and they do. That's
mm-hmm,
also a natural course of how your immune response matures and develops. However, yes, tea has a natural bronchodilator in it, theobromine, which can cause some amount of bronchodilation and help people. We also utilize it in some medications we use, similar chemicals.
mm-hmm,
However, that cannot be the only cure, and I wouldn't agree with this. It's a good thing that the child or the person has grown out of asthma and has not had any symptoms into adulthood. That's excellent. There's a very thin line between over medication and under medication and not and medication optimum amount of it. So it's very difficult for anybody to comment on. And yes, natural things like tea can help.
mm-hmm.
However, depending on the severity of the asthma, that's not the only thing you could be doing. Yeah.
Right. So in this case, it was probably just coincidental that the symptoms sort of went away on their own.
Probably, yes. And
And
yes, like I said, tea does
yes,
have a weak bronchodilatory action, and there's
yeah.
nothing wrong in taking it, but that cannot be only cure if you have
Yeah.
persistent asthma. So this is a lot of misconceptions. A lot of people feel, oh, children, you shouldn't treat them with a lot of steroids, and you shouldn't. And I agree, you shouldn't treat them with systemic steroids. But
Mm-hmm,
if they have persistent asthma, the amount of absenteeism they'll have from school the effect it will have on their growth and development, the asthma itself, or on their exercise and or what they can do physically, if you weigh that against taking a preventive inhaler, I think the inhaler wins the case here, right? Because the amount of impact it's going to have on their quality of life, their overall development, their health, how frequently they have to be sick and going to a pediatrician. If they were to take a preventive inhaler, and even if that contains a small dose of inhaled steroid, I think it's much better to do that. It also prevents chronic airway inflammation and later developing, what we know as a permanent damage to the airways, which then leads to frequent shortness of breath, or may end up, they may end up having what we know as chronic uncontrolled asthma
So
or
Irvin
fixed airway
says,
obstruction.
yes.
Just to this point, very quickly, I'd like to mention. So I think Harsha and I have been repeatedly mentioning that there is airway inflammation. And this is an example I give all my patients. If you scratch your hand at one spot and apply a band aid, it will do okay, right? But if you keep scratching your hand at the same spot repeatedly, it's never going to heal. It's going to leave behind a scar. How much ever band aid you may be applying on it, it's not going to help it, right? So if there is chronic and repetitive inflammation in the airways are going to eventually scar, or this is a term we know in medicine as airway remodeling. So the breathing tubes then become permanently narrow, something that usually we see in people who have smoked for a long time, or a condition known as COPD, which we have also talked about on this forum. It leads to chronic airway changes, and it leads to scarring of the airways, permanent narrowing of the airways, and leaves behind some amount of disability or chronic symptoms. This is not something we want any asthmatic to develop. And that's exactly why we keep repeating this importance of reducing airway inflammation, controlling asthma rather than reacting to it, and avoiding what can potentially be avoided to prevent repeated flares. And I think if this is something that we can reach across today on World Asthma Day to people who are asthmatics, that's very important.
Very good. All right. Thank you so much. Right. So Inspiring is asking about any sort of dietary adjustments, herbal supplements, or breathing exercises that can complement their asthma management plan. So I'm assuming, I know you said this was very sort of individualized. So when a patient comes to you who is seeking to, have better control over their asthma, these are some of the things that you would be discussing with them. Yes.
Very true.
Yeah, I
Very true.
think for this, I already told. I think like usually we send allergic panel set of panels, which can be a food party. I mean, food what they eat, which has common allergens, or the common allergens found in the environment. So if we find any of these, then definitely that can be addressed. We can either tell them to avoid, or there is other mode of treatment. We say it as immunotherapy, where or desensitization therapy, where we can give this in small doses so that they develop resistance to that, and the body will not be hypersensitive to the triggering factor or agent. So this is one of the methods of treating this, but best way, and moreover, we cannot identify all the allergens which are there, because millions of allergens. So that is, again, I'm insisting the same thing, that person will be the right person to identify what he is triggering to, and avoid that. That is the best thing which one can do. And one more thing, like, I just thought of answering I mean, there was a question where, like, after they were prescribed some herbal tea or something, then after that the symptoms did not. So it is actually not related to the medication which they take, which they took at that point of time. I would say it is the natural course of the disease. When someone having an asthma in the childhood, but over the time when they grow, the immune system, or the immunity, or the immune response changes in that individual. Because of that, over the time, naturally they can be like free of asthma. So that is why the best approach is to treat them when they have the trigger. Like, suppose if that person has a childhood symptom, so when we avoid symptoms during the childhood, naturally the child can be free of asthma. So that is what. But if we allow that to happen frequently in the childhood, there is a higher chances that when they become old or adult, so they can have these symptoms. Yeah.
Mm-hmm. Very good. All right. So thank you so much for that. We're going to start to wrap up just a little bit here. So Soka says that steam is amazing. Every hospital should have a steam room. Yes, I think steam can be good for so many different things. Herbert joining us from the UK is asking a question, and I think we know the answer to this already. Is smoking marijuana a good relief for patients? So we just said no form of smoking would ever be good for any patient who
For
has
any
respiratory.
disease, yes, it's not a
Yes.
good idea.
Yes. Good morning to Miss Angie. So again, inspiring. Maybe this is a good opportunity to, if you don't have your asthma, under really good control, maybe this is a good opportunity to contact one of the pulmonologist specialists. So let's talk about some of the complications for people who don't have it under control. What are they looking at? Everything from sleep deprivation, because it impacts your ability to sleep well at night, no doubt. Exercise avoidance, leading to further health issues like diabetes, high blood pressure, and weight gain. Permanent narrowing of the airwaves and various medication side effects. In children, unmanaged asthma can contribute to growth delays. Wow, that's shocking. And a higher risk for learning disabilities. Oh my gosh. So, this is why, especially for children, you want to make sure you prioritize proper management, right?
True.
Can
This is what we
prolong,
were talking about. Yeah.
yeah, can prolong recovery from respiratory infections. Severe untreated asthma might escalate to a respiratory failure, a life threatening condition requiring immediate medical attention. And to be clear, just in terms of that, there are still people who die from asthma.
Yes.
Yeah.
On an annual basis, you may have more than 450,000 people dying due to uncontrolled asthma. And that's really
Mhm.
unfortunate because asthma is something that can be controlled. And yes, there are certain
Mhm.
individuals who have what we know as severe or brittle asthma who can be very difficult to control. They end up
Mhm.
being dependent on oral steroids. But those are a handful in proportion to the number of asthmatics in the world.
Mhm.
So, controlling asthma is extremely important, particularly in this part of the world where we have access to healthcare, where
Mhm.
you can go and see a specialist relatively easy, where you can have access to medications. It would be unfortunate if we lost lives or quality of life due to asthma.
Right. Wow. And Irvin is asking, she goes to the gym 4 to 5 times per week. Is that bad? But I think again, if her asthma is under control, then that's the
That's good.
recommended amount of exercise. So that would be good. Yes. All right. So just to wrap up here, some worldwide issues as it relates again to asthma control. Today we're celebrating World Asthma Day. For those of you who may be joining the show a little bit late, Medical Rundown Tuesdays. This is an amazing opportunity for you to learn a little bit more about what can be a chronic disease for many, but some of the issues that face people all over the world: under or inaccurate diagnosis, underuse of anti-inflammatory inhaled cortisoid inhalers, overuse and over-reliance on short-term acting beta 2 inhalers, and poor recognition of patients requiring specialist assessment and further management, and availability of medicine in low to middle income countries. Again, Dr. Archita just said that we're in an enviable position because obviously, we have such amazing healthcare and expertise right here on this island. Herbert is also asking about the government doing more to control emissions from older vehicles. This is something that I always has found to be very interesting, that we don't do any degree of emission testing here for vehicles, but that is something, again, any pollutants, any air pollutants in the environment is something that can be a negative impact on those suffering from any sort of respiratory disease as well.
Very true. And it's a good idea that this be checked. And perhaps, a repeated advocacy on behalf of, I mean, on from everybody in the public
Mhm.
can help, uh, implement this in Cayman Islands as well. Having emission checks, avoiding, a lot of vehicular emissions or vehicular pollution can go a long way in reducing further, for the future generations can avoid having reduce asthma risk.
Mhm.
Yeah,
Okay.
and also one more thing, like here, a lot of the triggering factors or triggers are because of the poorly managed air conditions at home or anywhere else. I think that is one of the more one of the important thing and the common thing
Mhm.
we see. So they have to manage their air conditioning well, I think.
Yeah. Changing your
Yes.
pre-filters often, keeping the units clean.
Yeah.
For asthmatics, there are a lot of other lifestyle, small little inputs that can be provided based on an individual case and their triggers. And these are important. Environmental changes are important.
Mm-hmm. Mm-hmm. Right. All right. So thank you so much, Dr. Archita and Dr. Harsha, joining us again this morning as part of our Medical Rundown Tuesdays, bringing some really important information on World Asthma Day. And for those of you who, are suffering from asthma, you might have a diagnosis and perhaps you want to speak with the specialists at Health City Cayman Islands, please reach out to them. If you're not sure, if you're having any sort of respiratory, pulmonary type issues, listen, you can't get anyone who is better in terms of the professional accolades than Dr. Archita and Dr. Harsha. So please reach out to them at Health City. You can reach 640-4040 is the telephone number, the email address, info@healthcity.ky. You can reach out for an appointment. And they also have their Connect app, which I know we're still planning on doing a full segment on to show you how to utilize that app. But if you download the app, there's also a way to make your appointments that way as well. So sounds good. Thank you so very, very much to the wonderful team over at Health City Cayman Islands, Dr. Archita and Dr. Harsha. We appreciate you coming on the program today.
Thank you for having
Thank
us,
you.
Sandy. It's always a pleasure.
Take care. Thanks very much. All right. So there we go, folks. Thank you very, very much. Good morning, Darlene. Good morning, Savage Cabbage. So get oiled up. I'll be there in 5 minutes. Oiled up for what? All right. So, folks, let's take a quick commercial break, and then we're going to come back. And this next segment is probably going to blow you away a little bit. I mean, I know that I was surprised. So let's get it.
CMR has reached an incredible milestone of having the #1 talk show and being the people's #1 choice for news. We would like to wholeheartedly thank you, our loyal listeners and followers, for making this possible. This is going to be an amazing year of continued growth and acceleration, and we would like for you to be a part of the journey. If you have a company that's struggling to reach your targeted customer base, why not reach out to CMR's sales team? With over 200,000 followers on both Instagram and Facebook, your message will be more impactful by advertising with us. Speak to a sales specialist today about all of the ways in which we can help you elevate your game to the next level. Email us on sales@caymanmarlroad.com or call 324-1612 for a consultative meeting. Ocean Ridge Heights offers an amazing opportunity to own a piece of land in idyllic Cayman Brac, right on the bluff, starting from $80,000. Located in a quiet residential area with high elevation, these lots are ideal for a future home or investment property and are sure to go fast. Cayman Brac offers a laid-back lifestyle, amazing pristine diving, limestone caves, diverse flora, along with amazing wildlife. Inquire about the owner financing options so that you can secure your piece of paradise today. With only a few lots remaining, these are sure to go before you know it. Contact Crichton Properties today on 345-949-5250 or info@crichtonproperties.com.
Recover Personal Injury Attorneys, helping injured people get what they deserve. Did you know that insurance companies have lawyers that represent their interests? Before signing and accepting any settlement, know your rights. Call us today for a free consultation at 924-9999. That's 924-9999. Recover. Your personal injury attorneys are on standby to assist.
All right, folks, welcome back. Welcome back. Happy Tuesday. Everybody knows that yesterday was the reboot of Emancipation Day, and the celebrations and the different events continue into this upcoming weekend with Cayman Brac will be celebrating Emancipation Day as well. Let me just say this. I'm not going to dig too deep into this at this moment. We'll circle back to this at a later time. but I have it on good authority, as good as you can get on the Mall Road, that our current premier is not in support of Emancipation Day. And so that's why I'm told she has booked other things to do off island. And she's not here celebrating this reboot after 62 years of a break of having an official holiday. She's made sure that she has left the jurisdiction and wouldn't be here for it. My sources told me that her position is we didn't have slavery in the Cayman Islands, so she doesn't know why we're celebrating Emancipation Day. Wow. Mind blown. Let me tell you, I'm just mind blown when I hear stuff like that. I would really, really hope that this isn't the case, that this isn't true. But honey, child, and I try to say nothing but them brackers, but some of them really are a little bit special. So all I can tell you is like, what? Say what? I can't even imagine. Listen, when you run the country, you can't be so small-minded, okay? I'm just saying, we need our people to be a bit more, can we just be a bit more with the times, y'all? I mean, Lord Jesus, what on earth are you saying to me? We're not going to celebrate emancipation? You don't believe that we had slaves? It's not what you believe, it's what the history books say. How can you argue with this? I'm a little bit lost for exactly how we could come to such a conclusion. Lord Jesus, are we for real? When I heard it, I'm like, are y'all kidding me? This has got to be a really poor joke. Like this y'all are not serious. Yeah. This is about political maturity and just maturity in general. You know, this is something that's important to the people of this country. Of course, we had about 50-50 in terms of free people versus slaves. And I think that in reality, that's one of the most balanced, if you want to call it that, one of the more balanced numbers probably in the entire region, if maybe not the world really, of having almost an equal number of slave versus an equal number of free persons and, you know, people who own slaves. And I think that that's one of the things that has led to our amazing, on the one hand, diversity. And when you look at what we look like and who we are culturally, you see such a really great mixing of our people, right? You know, it was, you know, for a number of reasons, we had a little bit of forced integration even before a lot of countries were on board with it. It saddens me that all the events that we've had so far, we see other people acting as premier. We saw on Saturday's event, which, by the way, a big shout out to the team in the Ministry of Youth, Sports, and Heritage, who've done a phenomenal job putting together this entire celebration. But they had a dinner at Pedro Castle on Saturday. That was really fantastic. We got to see the drone show. I'm going to show you guys the drone show a little bit later on. It was really phenomenal to watch in person. If you missed it, I think you missed an amazing treat. But, you know, that evening, Minister Andre was acting. I think yesterday at the church ceremony, Minister Turner was acting premier. And then I don't know who else is going to be acting premier. That was Sunday, sorry. Yesterday she was acting at the Hogside Bay Day. Who was acting on Sunday? Anyway, they've been switching out. All the different people have been acting in place of the minister because she's just not here for it. My disappointment is just, I'm just like, wow. I mean, we haven't done this in 62 years. You think that you would clear your calendar and you would have had full advance notice. There's no reason for you to have been jumping on a plane last week, Wednesday or Thursday, to try to get to Miami to ensure that you would not be here. So my question now is, ahead of Cayman Brac celebrating it this coming weekend, will she be here for the Cayman Brac celebrations, or is somebody else going to be filling in for her as well? Now, we do know that Cayman Brac, as we shared on Friday's show, I know so many of you enjoyed Friday's show, that Cayman Brac did not have any registered slaves. But I think you'd be hard-pressed to believe that there was not some form of slavery or endangered slavery, and especially in the Brac, which I'm not saying nothing about the Brackers, but let's just say that they are a very different cup of tea when it comes to race relations. They're the people who believe that they're so white when they're really not, that you drink out of their glasses and they're going to throw it in the garbage, or they can only give you a plastic glass and all this kind of stuff. Brackers have been about 30 years behind when it comes to like race relations and that kind of thing, right? And there's a lot of Caymanians come high colored, high yellow, whatever, brackers who swear that they're white when they're really not, you know. And I find it so interesting that even when brackers decide to marry a person, you know, they have to go to the whitest of the white to try and marry. Like, oh, we got to go all the way to Texas and find ourselves a country bumpkin. And it's just like, okay, you black people, y'all special. We still love you, but you're kind of special. So, I mean, you look at her premiere, and obviously she is a woman of color. She is a Black woman. And for her to not understand how, you know, how this is such a amazing tribute to a good part of her history, to me is just shocking. I'm floored by even the suggestion that she is not here because she does not believe that we had slaves, and she does not believe in us celebrating emancipation. She's like, what have we been emancipated from? I tell y'all what, let me be very clear. What we need to be emancipated from come 2025, that's next year, is bad leadership in this country. We need to be emancipated from politicians who clearly don't have a clue and don't care what the people want. The people are the ones who've agitated for this. I mean, look, she's she about my complexion? I don't even know, because I'm not one with shades of color. But you know, hello, you're Black, honey child. I'm Black, you're Black. Nobody now counting the 20% European. That come on now. Let's stop the nonsense, okay? So I'm disappointed. I don't know. Darlene says that's her premiere, child. Damien says backwards. Wow, says Pat. Yeah, I'm a little bit speechless too. Strong Will says, good morning, Sandy. How was your weekend? Weekend was good. Coming in strong, honey child. Strong Will says that is so ridiculous. We still have slavery going on. My God. Morning, Ingrid. Darlene says, Sandy, slavery still going on, right? Marshall says, and the sad part about her is that she's supposed to be the education minister. Shaking my head. I'm just saying, Marshall, there's something to be said for that. Somebody was telling me earlier how education has really gone down. Like they're not even, I mean, I don't understand this because my daughter's not in the government system, but apparently they've changed, speaking of education, they've even changed how they're grading children so that you kind of don't know whether they're failing or not, because it's not like A, B, C, D, whatever anymore. I'm like, huh? How does that work? I don't understand. I'm confused. Anyway, we'll get there. We're not ready for that conversation. Strong Will says that this simply means that she doesn't know her history. Damien says, same as Biden as president and Blinken. And Blinken is doing the deals. Huh? Carla says, yep, I tried telling someone who asked about her Emancipation Day celebration was about yesterday. And she said she's from the BRAC and good with her people told her. I mean, Blackers, y'all cannot be that. What? That's the very definition of ignorance. Y'all are Black too. We're all one people. You know, y'all didn't have registered slaves in the BRAC because y'all was hiding them. That's why, you know, back in those days when they said, please register your slaves so you can get paid, y'all wanted to continue having them as slaves. That's probably why you never registered any. I'm just saying. Wonk, wonk, wonk. Miss Darlene says everyone is getting a shot at being our premier. Good morning, caller.
Sunday morning. You know what the simple answer to that is? We are in denial.
Oh my gosh, in the worst kind of way.
People are in denial that we all stem from Black. Mm-hmm. And that is our biggest problem.
Willful denial.
Yes, that's a simple simple definition. That's what's happening.
Yeah.
So
sad.
we can see where it's coming from. We're coming from the top, the premier. You know how that system work on her side of the world. Mm-hmm. So until we come to grips that where we coming from, we're not gonna know where we're going. Yeah. And what we have endured to get here. So that's my 2 cents.
Thank you so much. I appreciate that. Yeah, I mean, it is really sad, to be honest. I can't believe that we're in denial that bad. I mean, wow, that's kind of scary. That says a lot about us. Lord Jesus, take the wheel, take the bus, take the whole country. Siobhan says everybody else there for her. If she can't be there for this one, she definitely won't be there for that one. Ignorance is bliss, says Siobhan. Ignorance can be very, very dangerous. I hate to tell you, but it's true. I white too, take that, says Darlene McKenzie. Eve says, I hope the Broncos are hearing exactly where discrimination comes from. Why is Sandy disparaging you when speaking of others being discriminatory? So rude. Huh? It's because it's the truth. I mean, the truth, I guess, can be disparaging and it can be hurtful, but who doesn't know that this has been the history of Cayman Brac? Who doesn't know that Cayman Brackers have preferred white people over their own Black people? That they all pretend like they're white, not Black. I mean, is this news to anybody really? That they're the last of the ones to, accept equality on so many different levels. Is this really news? That they don't want Black people walking on their white sand when they walk up to their house. They'll tell Black people, you can't come inside my house, even to this day. Am I telling y'all something you don't know? I mean, how is this disparaging if this is the truth? Strong Wilt says, please give Miss Darlene a kaboom. Debbie says, I am mind blown. What a hot mess. Our people are suffocated, says Darlene McKenzie. Inspiring says, the first census of the islands was taken in 1802, showing a population of Grand Cayman of 932, of whom 545 were slaves. Like I said, it was about a 50-50, probably more like 60-40, but let's just say 50-50 to keep it simple. Irvlin says that woman bus, very prejudiced, thinks she is white. Who are you talking about, her premier? I mean, I don't, like I said, I don't know how people can look in the mirror and actually think that they're white. I don't get it. Caymanians, let me assure you, most of you have some kind of Negro blood somewhere in the family line, even if you came out a little bit fairer skin and, straighter hair, whatever. We're all one big Afrocentric family. Capiche? Go do your DNA test and then come back to me. Go do your 23andMe and come back to me. And I've seen people, and I've heard it myself. It's not just Cayman Brackers, to be sure. I've seen people from, all the way East End, West Bay, all of them talking about, my great grandfather was Scottish. And I was like, honey child, if you're going to go that far back to find your Scottish white roots, because that's what it's all about, talking about you whitish, I don't need to hear that. Just keep that to yourself. Really? So what? Like I said, I mean, for me, when I looked at my 23andMe, I was a little bit surprised, rounding it up to 20%, that I'm 20% European, because I don't really see it. I see this beautiful brown Afro face and features and whatever, from the bonkish straight down to the lips. Everything is African, as far as I'm concerned. So, but I'm not going to get excited because, I'm 20% European. Who cares? That's a minority. The other 80% is really, and for me, emancipation is more than, it's not a race thing. It's celebrating the fact that our people were, at least on paper, freed from slavery. And there's something to be said for that. And as a country, we have to acknowledge and accept that 50% of at least 50%, if not more, of our heritage and culture is Afrocentric. Everything that we do, from the dances and the singing and all that kind of stuff. I love the folk singers, by the way. Big shout out to the Cayman Islands folk singers. They're amazing. Miss Nasaria Shillette did her poem about Long Celia. This is our history. Like, people like Long Celia fought and took 50 lashes in order for us to be where we are today. And so by not even acknowledging these important historical people, I think we do ourselves a disservice. We do our country a disservice. We do our people a disservice. And there's a lot to be said for that. You know, it's just, it just blows my mind when we find that we find ourselves where our leaders are not even in a position to acknowledge their role, that they refuse to acknowledge from whence we came and who we are. It just boggles my mind. I can't explain it any other way. I am really shocked. And I don't think that this is indicative of good leadership in this country. Wow. Anyway, a few of you making some comments in relation to this. Let me bring some of these up on screen. Yes, I was shocked when I heard people saying that to me this weekend. And in fact, there were quite a few people that didn't turn out to these events, elected officials who were invited. And so to the ones who did, you know, big shout out again for your part in the ceremonies. So good morning, caller. Welcome to the program.
Good morning.
Hi there.
How are you?
Not bad. How are you?
Well, honey child. I don't think, I hear what you're saying, but I don't think that people should discriminate against their white ancestors because
we're not discriminating against them.
No. What I'm saying, some people are I hear some people talking about, oh, you know, I'm black, but I'm light skin, and so what are you doing? You're discriminating against half of yourself and celebrating the other half. So we are what we are.
Yes, you know, and like I said, we're very mixed people for sure.
Right. We are what we are, and you know, we had to have the slave master around the corner doing something with the little black girl for us to come out the way we all come out here in Cayman. Mm-hmm. So and I think that all happened because.
Let me be very clear, caller. What a lot of times that little something that was being done was straight up rape. I mean, let's not sugarcoat what this is, right? These women didn't have a choice in a lot of these situations. A lot of them were raped and sexually assaulted. And of course, out of that, you had mulatto children. And then maybe further down the years, it was more of a choice. But a lot of times in the early days, there was no choice there.
But I know, especially in East End, where I wouldn't necessarily go as far as say it was rape. I know, well,
it was rape.
That probably happened. It happens here, but you know, it ended up that you had the slave master, or whatever you want to call him, also end up marrying to a Negro type person. Mm-hmm. You know, I see that if you look in, I found it upon the seas, you will see the what they call the sophisticated black woman in there, you know, out of East End that were married to the Conley, you know. So
yes.
So yeah, and you know,
I mean, does it bother you? Let me ask you a question, because I feel like, Graham, you kind of beating around the bush this morning with me, right? And normally you're a straight shooter. Let me just ask you straight up. Does it bother you when you hear that our elected officials, in particular our premier and our leader, did not want to participate in Emancipation Day because she doesn't believe in it?
Didn't believe in emancipation?
Yes, she doesn't believe it's something we should be celebrating. She's like, emancipated from what? We were never slaves.
Well, okay. This is because, Sandra, because we were 50-50 almost. Mm-hmm. I think you mentioned that just now. Mm-hmm. I don't think our slavery were brutal slavery. I think
slavery is slavery, my friend.
No, but you mean like how?
What do you mean by slavery and brutal?
His wife. You mean like how my friend got his wife all locked away now and she can't go out of the house? What's that? And she got to work every day. That's slavery too.
Well, I would hope you're not gonna friends who doing that, and you still friends with them.
Yeah. I got a friend that
you got friends that doing that.
That my beautiful woman don't want them to put their foot out the house, locked down tight. When you talk about big buck and all that,
they got some problems. They got some problems.
What I said was, hey, don't jump in the water if you can't swim. Don't go and marry somebody like that if you
What are they afraid that they got somebody else can grab them up?
Yeah, Yeah, what do you think?
Oh my gosh. Well, that's a whole other show, I think. But no, I mean, listen, whether it was 50-50 and however you try to define this, it was slavery.
No,
I think Roy Bodden said it best.
What I'm saying, our slavery wasn't, say, a brutal slavery like how we
I think we need to stop saying that. What slavery is not brutal?
It was more, well, all right, because it was 50-50, we were not out in the field,
we didn't have, what we can say is we didn't have big plantations because of the geography of Cayman.
Right.
We didn't have big farms. So we didn't have plantations with, 10, 15,000 slaves on the plantation. That does not mean.
What do you call it? We're more like house niggers, right?
Well, that I know better. That I know better.
You had, well, I tell you what, if I had a choice, if I was in slavery and I had a choice,
you'd want to be the house nigger.
Oh, I'm up in the house. I'm up in the big house with master. What? I'm not picking cotton, master. Sorry.
No, sir.
I ain't picking no cotton, master. I won't be up in the big house with you.
And you do realize that the house nigger was the one who was back in all the news, trying to curry favor.
To that, make me tell you now.
Okay.
If I find out that the field nigger was planning to escape, I'm going and tell
you're gonna be the real house. You're gonna be the real house nigga who can tell on them. My God.
I'm telling master because guess what?
No. Well, at least you're willing to admit it. There's so many house niggers out there that don't want to admit it.
Well, guess what, Sandra? Anyhow, the field niggers escape and go. Then me, the house nigger, the how go out and work my field, No, I protected my job.
Oh my God!
I protected my position.
No, sir. Graham, I can't with you.
I'm going to tell master.
I can't with you. Graham is like, I got telling everybody because I need to keep that house nigga position.
You what? No, Sandra, come on now. If you had a choice of picking cotton out in the hot sun and being up in the house,
the choice is to be free. The choice is to be free, because when you were in the house with the master, he was raping you same way, including the men. Let me be very clear now. The men were not. A lot of you men think it was just the women that was being sexually assaulted and raped. You'd be surprised to know that men were being raped by both slave master men and women. So, a lot of the women running the plantations were kind of on the freaky side, and they would use, all of a sudden they see this black man with muscles and a body that they've never seen before, exotic African. The little white man wasn't quite, giving her what she wanted sexually. So she would sexually assault and rape the black man. But let me tell you
why I wanted to be up in the house with master wife and daughter.
Let me tell you something too, is the unfortunate thing about it. I mean, I don't want us to make light of this because this is slavery that we're talking about. The unfortunate thing is that it really also served to break apart historically and in real terms, the black family. Like they were always looking at ways to separate families, whether it's mother and child, husband and wife, using them as property and abuse them whenever they felt like it. So, you might think, oh, this was going to be a sexcapade, a fun swinging party. But believe me, Graham, that's not what it was, So it is what it is.
So,
yeah. I mean, I think you were thinking of it in today's context, and you have to be realistic about what was really happening back then in the plantation.
Yeah, well, I never experienced all that.
I know, but that doesn't mean that it didn't exist, and it doesn't mean that our forefathers. Yes, and it doesn't mean that our forefathers didn't experience it. And so, as we celebrate Emancipation Day, as we celebrate the road that's began, the singular thing that began our road to freedom, into being liberated, right? We can't have leadership in this country talking about slavery didn't exist,
no.
And why are we celebrating emancipation and all this kind of stuff.
Well, what I'm saying, if that is being said, then that is not true. Then that is not our history, because our history says something different.
Mm-hmm. Well, Ryan says that you could have taken Samuel Jackson's role in Django. That was the same Django, Django Unchained.
Very much.
At least you're willing to admit it, because we got enough of them around here who don't want to admit it. Thank you so much, Graham. We appreciate it. What a hot mess, honey child. Well, honesty above all else. He's saying he's happy being the house nigger. Some of you, like I said, you take that role on anyway, and you just don't want to admit it. So at least he's honest. And this Symphony of the Sea says, this is why Cayman loves submissive Caymanians. Charles Whitaker says, that is Graham. Sad how she came on will never be better. I think I'm missing something there. Listen to Graham Rankin. No, I mean, listen, I know Graham might be trying to be funny, but I don't find anything funny about it. These were not consensual relationships. This was rape. And, our people, after 62 years, we are here coming back to, I think, a place of celebrating a very, very important part of our history, which, not for nothing, but realize that we were basically whitewashing what happened in 1835. And we had erased it from the history books, so much so that our people weren't even sure why we stopped celebrating Emancipation Day, the holiday that never even properly had a name to it, right? This says a lot about us as a people, how we're not willing to own who we are. Good morning, caller.
Morning.
Hi, morning.
Well, I have a theory and a reason why we hit Emancipation Day, and if my field said it the best. When slavery was being abolished or emancipated and stuff saved, there was an uprising around the Caribbean. So a lot of the merchants weren't wanting to come to deal with that kind of uprising because they say, boy, they can't do no business, they're losing money and all kind of stuff. Cayman Islands is one of the first places to say that we never had slavery, so we could get these merchants to come here. That's the reason why for 62 years and years before, we have hid that. That's the only reason for wealth. We hid our slavery for wealth.
Yeah.
That's exactly why, if you check it up, why the 62 years, why we just getting it back, find out why England have it on the books as just a bank holiday, like it was here, unnamed. It's all about hiding for the merchant. Thank you.
Thank you so much, caller. 936-2626. Yes, I mean, listen, we had reasons why we needed to whitewash our history and who we are. And like I said, I'm always shocked. I remember when I first moved back to Cayman, because in the States, there's just white and black. There's no high yellow and this and that. And, when I heard Caymanians describing themselves in this way when I came back as an adult, I was just like, confused. That was the best way to explain it. I didn't quite know that I understood what I was hearing. My ears were like, what? You're and people would say it to me like, oh, I met somebody, blah, blah, blah. Okay, I'm trying to figure out who she is. What she look like? What shade she is? And I'm like, shade? She black. No, I mean, like, is she black like this? I was like, listen, I can't. My brain doesn't process things that way, because when you live in the United States of America, you better believe there's black and white. There's not a whole lot gray area and no in between, and you fit into your little box. You Asian, black, white, boom, that's it when you get your little survey. And so it is what it is. Charles says what I was saying, that this side, and this is why the Cayman Islands will never be any better. Well, it's a hot mess. It really is. Good morning, Gabby. So listen, this is wild to me that we have leadership in this country who don't want to celebrate such an important, momentous occasion. In fact, I would have expected, again, after 62 years, I would have expected a statement from her about Emancipation Day. And did I miss it? Because I saw nothing coming out of her office about the acknowledgement of this important holiday. Now, here is the interesting thing about it. I applaud this government for, finally getting it done and moving forward with it. But the desire to bring emancipation back, because you guys know that 2 years ago, we were here talking about it. I personally reached out to Premier Panton at the time and said, we need to bring emancipation back. He said they were talking about it. They were going to do it. I think that it is so ironic that, the person that brought emancipation back would have been a Panton, Wayne Panton. He's like, this is an important holiday. We need to explore this. We need to push for this. And here we have Madam Juliana O'Connor Connolly looking a lot different than a Wayne Panton, being the one who's like, oh, we never had slaves and we don't need to celebrate emancipation. Wow. I am just blown away. That's all I can tell you. I don't know who else is blown away, but I'm blown away. Speaking of being blown away, can I tell you all, what else blew me away? So listen, I have been, before we get to that topic, we're going to switch topics. Before we get there, let me read these comments that came in. My apologies. These came in on WhatsApp. So we have this person making the following observation. Good morning. She's correct. We're still enslaved with these bunch of elected idiots. Notice how to spell idiots. We need emancipation from the 19 fools elected. I heard the Brackers used to dig up their sand if a person of color walked on it. Says a lot about how Juliana thinks. Then they go on to say, you're trying to kill Juliana, telling her she is Black. So to be very, very clear, I'm not trying to kill anybody. Tell them that they're Black. I mean, if you're Black, you're Black. This person says, I know, and I'm a patient of Dr. Cheetah. Oh, thank you for that. Black people don't like Black people much anyhow, especially with their lighter skin. Andre Ebanks was in the BRAC acting as premier at Captain Harrison's funeral. How sad is that? Why was she not there? Again, a Bracker. She don't believe she Black, my dear. She's light skinned. It's because she never made it come back. She never made it come back. So she's not going to support it. She's like Makiva Bush and the PPM. If they never put it in place, they will not support it. It was Wayne Panton that brought it back. So she's not going to support it. That's sad. That's sad. Sad and uber petty. My people, y'all need prayers. Y'all need deliverance, but like in a real way, not all this fake stuff. Okay? I can't believe it. Good morning, Miss Darlene Manzanares again. Says Sandy, remember we are a mixed duo also to the Spaniards who left from Columbus. Shells, good morning. Says if we never had a history of slavery, where do our Black people come from? It just boggles my mind. And, you know, this isn't about, as Graham said, you know, we're mixed people, but believe me, there's no need for you to celebrate your European heritage. That has been forced down our throats like, I don't even know what. Worse than the turtle meat. You listen, everybody knows about the European stories and the Christopher Columbuses and all these discoverers and whatever. What you don't hear is the amazing contributions that Negro people have made over the years. So Wee says, Black is so beautiful. Carla says, someone commented that they should be a monument for Long Celia. I agree 100%. Yes, indeed. She should be a friggin' national hero if you ask me. Taking 50 lashes, most of y'all wouldn't be able to survive 10 lashes, much less 50. Damien says most music beats are from Africa origins. Even a banjo was made by slaves in the US. Al Ebanks, good morning, Al. Says, finally, a holiday that I can celebrate. I was emancipated from mental slavery a long time ago. I smile every day knowing I came from greatness and don't struggle with an identity complex. I never beat a dead horse trying to change haters' mindset. What a hot mess. Carla says, I call myself a light-skinned Black. Black is beautiful. Aliano says, passed through yesterday. The event looked a bit tired. Plus, I didn't see no good food stalls. I didn't go yesterday. I was on a little bit of a staycation. But, okay. I mean, I normally keep my ends getting the food right. Irvelin says you're normally Black or white and there's no in between. By the way, speaking of my staycation, big shout out to the good folks over at the Kimpton. We were treated to a good soul, treated really my husband, not me, to a little staycation. And so this is my first time actually staying at the facility there. And I must say the service was impeccable. The staff, I was glad to see local faces, you know, good to see that. And the staff were really, really phenomenal in their delivery of service. I mean, I can't really say anything bad about the experience. And you know what was really fantastic? They're pet friendly. So Zeus got to come along and boy, did he have a good little time hanging out there as well. Aliano says it's called a selective perspective there, Bobo. The mixed breed came from something not right. Corvin says, I heard that a marine company sent a Black, what is this? Envinrude motor to the BRAC instead of the white one the owner ordered. The owner specifically requested not to have any Black parts on his boat. What a hot mess. No, sir. I guess they don't have any black cats on the brack either. Johan says Brackers and some other Caymanians must be in denial about the history of Cayman and slavery. So, of course, some are offended by Emancipation Day celebrations. Ingrid, good morning. Ingrid says, my grandfather, was white and blue eyes. My grandmother was white and green eyes. My mother was white and blue eyes. My father's black and very clear brown eyes. My nephews and nieces are dark skin with green, clear brown or gray eyes. And I have 2 sons, one black and one white, with green eyes and very clear brown eyes. God made black and white people. Johan says Cayman's history has always been whitewashed to protect certain families and bloodlines because apparently everyone was a saint back in the day and the wealthy merchant class loved and protected their slaves/workers. No, sir. All right, let's switch gears. Tammy says it was great seeing you and your family. Thank you so much, Tammy. You guys are amazing there. Like I said, really providing amazing service. And even Zeus had a fantastic time. He loved it. We'll be back. Damien says over 100 million Indians were killed by colonialism and between 1.2 to 2.4 million African slaves in transit. Shaka Zulu, good morning to you. Any thoughts on Cayman News Service recent article in Cayman's history in regards to Columbus' supposed discovery? I didn't read it, so I can't comment on what I didn't read. My apologies, Shaka Zulu. So I can't comment on it. Sorry. Dean says, as long as their ties remain to Britain, they'll be hesitant to admit slavery by powers at hand. I don't think that that's true. I mean, even the British, I guess, to a large extent have accepted, and let's be honest here, the proclamation came from Queen Victoria and came from the Queen and signed by the Queen's hands and all that good stuff. And in fact, what we discovered is that initially, I think on the issuing of the first order, not a whole lot was done. And they had to the UK had to agitate for Emancipation Day, even on our little small rock. And they had to say, okay, from today's date, this is it. Y'all gonna let them slaves go. And, they then, we need to make our little claims and we need some money. So they even put a compensation scheme in place to try to help the slave masters not feel the real pinch of like freeing their slaves. That's why they had this transitionary period of indentured slavery, which was still slavery, except they threw a little penny at you kind of thing, supposedly. I'm sure most people never even got paid, So let's be very, very clear that emancipation was forced on the people. It's not like the people had an epiphany and the people wanted to fight for their own freedom and their own rights. Far from it. All right, let's move on. Time is against us. So listen, this Cuban migrant situation has been one that we've been dealing with now for a number of years. And even on this program, we've covered a lot of news stories on them protesting and the Panamanian boat that they commandeered and all this kind of stuff. And, I try to, in my endeavor best, I really, 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 really try to be fair to people, right? I don't care, whether you're white, black, West Bay, East End, African, Kool-Aid, whatever. I really feel like humanity and what I try to do dictates a degree of fairness. Caymanian, Jamaican, Honduran, it don't matter to me, right? I'm not as concerned about those issues as I am really bringing the truth to the forefront. And so this time around, as we started to reflect upon, again, the Cubans were protesting. When I went out there, I said to them, listen, I need them to understand the position of our people. Caymanians, how Caymanians feel about you Cubans protesting. At the same time, I said to them, you know what? I want the people of the Cayman Islands to also understand what your issues are. Why are you constantly protesting? What is the problem? Because from our perspective, it really is black and white. We say these are the most ungrateful people in the world, and that's it. We don't care. We don't want you here. It is what it is. However, I must say that if we are to be fair in the circumstances, we need to consider that we don't have a proper context of understanding, most of us, of where these people are coming from and the circumstances in which they are in their own country. Now, that doesn't make it our problem, right? So don't misunderstand what I'm saying. I think the truth of the matter is everyone has a right, and I said this last week, to try to protect their own borders. The truth of the matter is the more you have a decent way of living and a decent life, the more you feel the pressure to protect what you have, which is understandable. We're all humans. This is human nature. And I even said to them, we have a little Cuban chat group, and I said to them this weekend, the reason why people migrate and run to other jurisdictions, number one, economics, and number two, violence and war. Those are the top reasons why you have illegal migrants and the flux of migration all over the world, right? Cuba is no exception. 99% of people who leave Cuba, it's because of economic dire situations. If Cuba was a bustling, capitalist country, people could make their money, could sell, could do this, they had the freedom, whatever, most of them would not even have anything to say about the political issues. Let's just be very, very honest here. That's what drives migration in most places in the world. Just over the weekend, we saw almost 300 Indians somehow landed in Jamaica. And, the Jamaican government has already put their behinds back on a plane and sent them back. So they're like, listen, we're not opening up our borders to almost 300 illegal Indians who've come to this country. This reeks of human trafficking. Those people are like, no, honey, child, Jamaica said, not today, Bobo. You go back to India or wherever else you come from. You're not staying in Jamaica. Okay? Over 238 Indians or something. Nah, they done send them back. Yes, from yesterday. They already had the plane arranged. Let me go and I'll tell you exactly. They left at least 15 hours ago. They already had the plane ready to go. They called the Indian government, was on the phone with them. We're going to be sending them back. Y'all better process them. 218, thank you. You better process them and take them back because we're not keeping them in our country. They were swift. Okay? These things happen. There's an element of human trafficking in every single country in this world. Let's not mistake what's happening. Now, in an effort to get to the bottom of the truth with these Cuban nationals here in Cayman, it is necessary for us to have a conversation with them. I believe in conversing. I believe in, you tell me what's going on. I'm going to explain to you from our side what's going on. I don't have any issues listening to people and hearing people out because you'd be surprised what you can learn. Now, let me tell y'all something from a personal perspective. Yes, you know that I lived in the United States of America for 15 years. And at some point, I actually, in my head, was going to just stay there forever. I had no intentions of probably ever coming back to Cayman. When I think about when I was in that mode and I wanted to remain in that country, and I was like, okay, these are the laws. I got to follow the laws of the country. This is what I need to do in order to stay in this country. You have to follow the laws of the United States of America. You're not going to fool with them. There can be a sense, and I understand it. There can be a sense of desperation when it comes to this is where I want to be in my life, right? And if you have to overcome all these uncertain hurdles and stuff, it has a mental impact on you. And you'll see in this interview, we are going to take you and do a deep dive into how the Cubans are living at the Bordentown Civic Center. The young man who speaks very good English, I was talking to him and he was sharing his experience about what it feels like to be in this country and have such an uncertain future. He doesn't know now. For years he's been here. He doesn't know, where he's going, what's going to happen. He's like, it has an impact on your mental health is essentially what he was saying to me. As one human being to another human being, I could sympathize with him. In that moment, I understood exactly what he was saying. I saw him get teary-eyed and I'm like, I understand. I understand where you're coming from. I understand your emotions. I understand, I get it. And we're human beings. Like I can't deny that these people are human beings. And if they come here, although they've come here illegally, and a lot of times they are a little bit confused about what their rights are because they've landed here illegally. They do feel like they're entitled to certain things, maybe not as much as they think. However, what I do believe that they are entitled to is if our government says that they have to house them and they're going to treat, they're going to have them in housing, whatever, we have to treat them with some degree of humanity in terms of that. Let me be very, very frank with you. What I saw last week at the Bontown Civic Center is deplorable. There's no other word to describe it. It is sickening to my stomach. We have to take, as a country, we have to take some accountability here. We have created a situation, and I understand some of the dynamics that have been at play, because everybody's like, well, this is how they're choosing to live. This is the conditions that they want to live with. And I want to caution you. I want you to watch this video with an open mind, maybe even a little bit of an open heart, because comprehend what we have done. Number one, I understand that there have been Cubans, and I said this last week, who've come here and live in private housing and did the worst to the private housing. There are things that we need to do as a government. When I say we, I'm talking about our government, to ensure compliance, right? So you don't just take 40 people and put them in the Civic Center and give them $160 a month for food, that's their food budget, and say, figure it out. Because you're going to see, when they have to figure it out, you're going to see the makeshift rooms. These people want privacy. They're like, at night, we want to be able to sleep in comfort. They have created, you know what this reminded me of? What is the slums in Brazil called? There's a term for it, favela, right? You know what the favelas look like in Brazil, right? These are the slums of Brazil where they just pack each other up on top of each other and whatever. It's like an eyesore, and people make do with whatever they have. This is how poor these people are. When I walked into the Civic Center, I could not believe my eyes. I couldn't believe what I was seeing. To me, I was like, oh my God. That was the first thing that came to my mind. The Civic Center is unrecognizable. I saw somebody said, oh, well, they're going to have to move out soon because we're going to need it as a hurricane shelter. Need what as a hurricane shelter? Listen to me. If we ever move these Cubans out of there, you're going to have to gut the entire Civic Center from top to bottom and start over. Maybe the external structure is savable. This Civic Center is unrecognizable. Unrecognizable. Now, let me ask you a question. How many of our elected officials have ever decided to step foot in the Civic Center and see how these people are living and what this looks like? I'm willing to bet you not a single one. In fact, I'm going to put out the challenge here today. 936-2626. Call in any elected member and tell me that you've ever stepped foot in the Civic Center, because if you had, your humanity would not allow you and any good conscience to say that we as Caymanians are allowing other human beings to live in our country like this. I'm sorry, but we have failed, right? I want y'all to understand me. This isn't about, oh, we're going to give them asylum. We want them to stay forever. We have failed as human beings to allow people who are so desperate for their own little spaces to live in these type of conditions. I got to show y'all something, because I cannot, when you see it for yourselves, you're going to understand, quite frankly, what the issue is here. Listen, I am flabbergasted beyond. Caymanians, this is not who we are. This isn't us. This is somebody else, right? This is not who we are as a people. This whole situation has broken my heart. CBC says that these Cubans are costing us $3 million per annum. And I am asking now, where is the money going? Because you cannot have people living in these types of a situation, this type of environment, yes, where they don't even get cleaning supplies. Nobody goes in there and cleans. Now, listen, I'm not saying that you gotta, you have to give them cleaning like a help or anything. What I'm saying is, if you're only giving somebody $160 a month, how do you expect the person to be able to pay for cleaning supplies out of that as well? That's not gonna work. So at the very minimum, provide cleaning supplies to them so that they can clean for themselves. It is despicable. Caymanians, this cannot be who we are, right? For the time that they're here and for the time that we are being processed, that they are being processed, my apologies, we have got to, at the very minimum, my God, y'all can see what I mean. Let me show y'all a couple pictures before we get to the video. I know that not a single MP has ever visited this facility before, right? Because like I said, I cannot believe that any of them would visit this facility and not have concerns about the conditions in which these people are living. It's no wonder that when one of them gets chickenpox, they all get it. It's no wonder. I think we are lucky that other communicable diseases have not broken out in this place. It is absolutely deplorable and absolutely shocking. Have a look. Have a look for yourselves. They have makeshift beds, right? Mattresses that are disgusting and dirty and dingy. People have donated some stuff. This is what they have done. They divided up as much as they can all these little miniature rooms. They built these rooms themselves. You've got electrical cords hanging all over the place, a very dangerous situation. If a fire breaks out in this place, these people are all going to be dead. They try to secure their little places with like padlocks and stuff. Big shout out to Flo. Somebody used a Flo banner to basically create these dividers. So they purchased, well, they didn't purchase, but people gave them doors. They donated doors, whatever. They put these doors up. Then they use sheets and other things to try to create these little miniature rooms and miniature dividers between each other. They put padlocks on every single little door to try to prevent people from going in there and stealing their stuff. There's so many hazards here. Tell me something. Our fire service, how is it that our fire service thinks that this is okay? How has this ever passed? Right? My God, help me understand this. How is this something that would be, you can't even open up a restaurant without the fire service coming there, or you can't have this way, you can't do it. How has this passed as a living facility? Has the Cayman Islands Fire Service ever been in here? Seen all the electrical wires hanging all over the place, the fire hazard? One fire breaks out in this place and every single person in this facility is dead. This is complete non-compliance by our government. And I don't know who ultimately is responsible for this, right? But to knowingly allow people to live like this is a problem. I am beseeching this morning the government of the Cayman Islands to do something about this situation. I cannot, in good conscience, after what I saw, sit back and say that this is okay, that we are doing enough. We are putting people's lives at risk. Not to mention, when our CBC officers went there last week, And they had a, job to do in terms of they're trying to extract 2 of them who got away from the detention center. And this is where they ran to be with their own people. When they go in there, they're also putting their own lives at risk. That's deplorable. 40-something people with 2 showers to use and 1 toilet upstairs. I think that was upstairs. And then there's like another little one downstairs. Between 40-something people, the guy talked about when they have to shower at night. Sometimes they're waiting into the wee hours of the morning. They all have to line up and wait. They have men and women. There's like 3 women at this facility. I could not imagine being a woman and feeling safe in that environment around all of these men. There is so much wrong with this situation. Do you all think that it is a mistake why you've never heard or never seen the inside of this place? We went there. And let me tell you something. I said, boy, Caymanians can tell you God works in mysterious ways, and he sure does. Because after I had the complete tour of the facility, here comes the security guard telling me that, oh, miss, you can't go in there. And I said, what? Yeah, you can't go in there. You don't have permission to go in there. I looked at him and laughed. I said, well, I've already been in there. Too bad for you, honey child. I've already been in there. So had he been doing his job, and I guess they can fire him after today, I don't know, that's not my business. Had he been doing his job, you, the people of the Cayman Islands, would never get to see what you're about to see today. No one has ever been given access to this place. And you have to ask yourself why. Why is that the case? I can show y'all why that's the case. Because this is an eye-opener. Look here. Sit back. All right, so as we open the door, this is what we're greeted as. I guess people are living in this section. So I guess the Civic Center is not usable anymore as a Civic Center. Okay. Huh. Look at all the wires and all the electrical stuff. Look at this mattress. Like basically somebody just gave them all these mattresses and they just put them on top of each other. Listen, I'm so disturbed by this, truly. Some mattresses, no sheets, no nothing. Where's everybody? We're going to find out where people are. Hello? Hello? Hello?
Good morning.
You want to message them on the WhatsApp and say, estoy aquí? Okay, we're going to see where they are. I don't know. I mean, there's... Hello? Yeah, maybe put a chair there. Or... Yeah, okay. Yeah, there's no natural light in here. There's a lot of flies in here, too. Hello?
Good morning. Buenos días.
Hello. Okay, so I see this would be like a makeshift bed, I guess. This is like somebody's little area in here. Hello?
Good morning.
Oh, hello. Hi.
Here's everybody.
Oh, this is another little room here. What did this used to be? I don't remember. Wasn't the Civic Center just one big room?
No.
I guess they created like little rooms now? Public restrooms. Looks like a little makeshift kitchen. That says women. Do people, this is still the restroom or? Hello? Maybe we have to go upstairs.
¿Dónde están los otros compañeros? Arriba.
Oh, okay. So, what's beyond that door? Hi. Upstairs. Okay. Yeah, I haven't been in here in years. My gosh. Oh gosh, stinks of cigarette smoke in here.
morning, buenos días. In the back, he said.
What the hell is all this stuff?
Good morning.
So these are like shower facilities? Man, it stinks of smoke in here. Oh my God. So this is a bathroom. Okay. So where's the shower? It's not the most pleasant smell, I'm gonna be honest with you. There's no proper ventilation in here. Lord Jesus, what happened to the lock? Okay.
Good morning.
Excuse my language. What is this? Hello?
Buenos días.
Hello? Buenos dias. You have something to keep that door open? This is, oh my God. This is pretty nasty, actually. I'm not gonna lie, this is not. Hello?
Good morning.
I don't know which direction to go. Wow.
Good morning, buenos días.
How is this little door added? Okay, I guess we go down. This is like when you see those, what do you call those areas in Brazil? Like the favelas? I don't know, but. Oh my God. What the hell? Hello.
Good morning.
How do I get you the music?
Good morning.
Hi. So this is the kitchen. Oh my God, what the hell?
Y es que tu país no te quiere conmigo. Seguro piensa que yo no quiero. Será porque te busca el canal. Dile que se quede tranquilo. A ti te gusta el reggaetón. Y tú me pasas la cabrón. Baby, cuando te lo metí, también metí el corazón. Dale, dale. Detrás de mí tengo una pala. Pero como tú me.
¿Dónde están los otros? Buenos días. ¿Nos puedes llamar, por favor? Le dice que el noticiero está aquí.
Buenos días.
Hola, buenos días.
Buenos días, ¿cómo están?
¿Todo bien y ustedes?
Bien.
Bien, bien.
Les habíamos mandado mensaje que nos esperaran, ¿no?
Sí, sí.
Okay. So, oops.
Okay.
So these are like.
¿Esto que aquí quieres?
This
They-
is some
they builds
some rooms, like kind of room, because they want to have some kind of privacy.
So you guys build this on your own, or?
Yes.
Put that on for me. Microphone.
Oh, thank you.
Yeah. So I see you use like tree.
Yeah, we
piece
use
and-
tree. What we find. Some Caymanian, they come here and they help us to, for example, with the doors, with the steel. The church give you some some cover
Buenos
like
dias.
cheese for cover all the thing. Because when we arrive here, CBC only bring all the people to here and only give them a small bed, nothing else. So there is lady, there is man, so they want to have the privacy, you know. Come, if you want to.
How many like rooms do you have here?
I'm not sure, but It's almost like 20 and something. Yeah.
Okay. So you put like a little section, one person staying there
One person staying
with
there,
their bed.
yes. And we share
This is your house?
the freezers.
Can I look inside?
Oh,
You're cleaning it? Yeah, but I just want to have a quick look. Oh, you're cooking.
He's cooking.
So you have food here, and okay. This is water. What is this?
This.
Oh, okay. See. Okay. And a little fan.
Thank you for coming.
Okay. Okay. Thank you so much.
So you were saying
Yeah, I'm gonna. Some of the rooms are kind of dark, so I'm gonna use a light.
This gentleman behind you is saying everything that they have here, like for example, their food and their stuff, is they get it on their own. Nobody provided for them.
Yeah.
Nadie se los ha dado.
Yeah, I have to clarify that sometimes Caymanians people, they come downstairs, and they give you like clothes that we appreciate that. The church, sometimes some people here, we go to the church, and the brother there, they share food, they share whatever they have to help us. Yeah, and for example, they give you this for save the food because we are not allowed to work.
Yeah.
So we only go to the foster one day at the month and buy everything for along the month, all the what we can. So we have to bring the food and save it until we can go there too.
So this is fully working. This is working.
Yeah,
good?
it's working. It's working.
So
It's not working at the first, but I fix it. I can fix a thing. I fix the TV sometime when I'm
like
stressing.
people donate stuff to you, basically.
Yes, I fix it and give it to them, and they can use it.
Okay.
Yes, the guys that, for example, the public bus, sometimes they don't they take you and they don't ask money from us. They say, okay, I take you guys. And we appreciate
So the
also
public bus doesn't charge you.
Sometimes.
Sometimes,
it doesn't charge.
but
Okay.
we also have to go to immigration every first day in the month to sign. We only receive one food stamp with 160 CI for a month, and there is people like for example him that only receive 110 for a month. Yeah, I have been.
So everybody has like a little lock for their door.
Not all of them. For example,
lot of
there
them.
is some guy that they don't get a lock yet. Yeah.
Okay, I see he's locking up his room.
So all the time that we are living here, nobody come to, for example, clean the AC,
The ventilation.
or
You
change
guys allow smoking inside? There's a lot of smoke here.
Some of them is smoking.
Yeah.
Yeah. Some them.
So if you're not a smoker, you have to put up with that also.
Imagine, for example, in my case, I don't like smoke, I don't like drink, nothing like that. So for me, it's better stay in my room and don't. If they wanna do, they wanna do. It's not easy to control all these people,
Yeah.
So
this is another room here also.
yes, it's another room.
Okay.
It's locked in there.
Wow.
Each one have their lock.
Yeah.
You can go
Wow.
from this way.
This goes like around?
This goes around?
No, not really. Only we have two more rooms here.
This is an eye opener.
One here and one down there. Yeah.
Oh, okay. I see. That's the end there.
Yeah.
Ah.
Down there is more rooms.
Yeah. Yeah, we have
I was gonna put on
one
my.
here and two more inside. You can come. One more here.
Wow, this one has a fancy door. It's almost like a house. Oh my gosh. Oh wow.
Yeah, that some Cubans have skill, building things.
Yes.
Yeah.
Wow. And then in these rooms, they have air conditioning running also?
No,
The central AC.
Central.
Ah.
Yes, it's central. Yeah. Maybe some people have a fan
Mm-hmm.
Yeah.
Look at that spider. Ay.
Okay, so outside here now.
Wow.
Dime.
Okay. This is the
Sí,
back.
después
What
le
used to
hablo.
be the back entrance
Right.
of the Civic Center.
Okay.
So some bicycles here. And then this is some of the wood, I guess, they use to make the different compartments.
Yeah. So imagine we are like right now, a lot of Cubans they gone, but we are almost 40 and something people.
Like 40 people.
Yeah, we only have 2 showers and 2 bathrooms. So sometimes you have to wait until middle of the night because it's a line of people
to take a shower.
Take in a shower. Imagine, and if they are using the restroom, worse. Yeah. Yeah. This is the shower.
These are the showers.
Yeah.
For men and women? Huh? For both men and women here?
Yeah.
How many women do you have?
2, 3. 3 of them right here.
3 women.
3 women.
Wow.
So as you can see, we fixed all the light because here all the light was broken. So we fixed it. Now what happened is that sometimes there is a person that is in charge of the building, and I speak some English. I try to speak with them in one occasion. I say, "Hey guys, why you don't give us some supply for clean the area, for example, change the proper light that the building need?" And they say that they cannot do that.
So you guys don't get any cleaning supplies?
No. We only have from the government the 160 CI in the first time. It's not like cash. It's only
It's like a card.
It's a card, and that is like you only can go and buy in the Foster and price rise. You cannot go to other place to buy. So if you need money for travel to take a bus, you don't have the money. And we have to travel to immigration. We have to, for example, go to the laundry. The forest that some people here sometimes the Caymanian come because we have plenty Caymanian friends here. They come in and play football in outside with us. Yes, and say, "Hey primo, you need some money for lunch, for something that you need," and they help you with that. Yeah.
So there's no laundry facility here?
No. Okay. What I did is that I'm a person that I'm electronic. You know, I can fix whatever you imagine, like computer, phone, and that thing. So some people bring me this watch, the watch machine, and I fix it and we put it inside. But a long time that we only have only one. So it's complicated, kind of complicated. Yeah.
And then they hang their clothes here.
Yeah, we don't have dry, so we put it outside. The sun do the rest of course.
Wow.
Okay. You wanna come for the plate?
Yeah, sure. So, like how this isn't working, soon the government will do the bulk cleanup. Like if you put it on the side of the road, maybe you can put it out there and they'll pick it up.
Yeah.
But yeah, wow. Yeah, there's a lot of garbage around the place here.
So there is something that the people maybe need to know. When you only have money for food and clean, you have to get the priority. Maybe is the food. So sometimes we don't have bags for putting the garbage, and what we do is we use box. No garbage bags, no garbage bins.
Wow.
And now we are here, but before this was like 80 people living in the same building.
Wow. How long have you been here now?
Well, in my case, 2 years and a couple of months.
Yeah.
Yeah, imagine that I learn and speak English.
You learn English here?
Yeah, I learned because I went to the church, and Pastor Martin, he's trying to speak, to learn to speak Spanish, and I'm trying to improve my English. So we share. Yeah.
That's good.
Yes, and when the Caymanian that come and play with us, they do the same. They try to teach you. Yeah, and they learn from us Spanish. Yeah.
Wow.
How old are you?
I'm 28.
28.
28 years. Yeah.
What did you do in Cuba when you were there?
You mean work?
Like you were a student or you were at work?
No, I have my own business. I'm a electronic. I have my store. We fix computers, cellular phones. Okay. We also build motorbikes. We build it and we help to the customer to very pretty and nice.
Yeah.
Yeah, but also I was like you, like a periodist. So I have my own social medias, and in that social media, I share the news that happened in my locality, my location.
Yeah.
Until I make a post on Facebook, and the government don't like my post because it's something that shows the reality of Cuba, and therefore they try to send me to the jail, 15 years, only for that.
In Cuba?
Yes, and now the law is
What
worse.
part of Cuba did you live?
I'm from Manzanillo.
Okay.
It's like the countryside.
Yeah.
Of Cuba, and now the law is worse. Now they can send you to the jail forever, and they can kill you for that.
For social media posts.
For social media posts. Yes, it's complicated because the people join like me, they are sending now to Russia to work in the Russian world.
Yeah. So that's one of the reasons that you decided to come to Cayman running.
Yes.
Now let me ask you a question. When you left Cuba, were you trying to come to Cayman, or you were just like go anywhere but Cuba?
No, we just tried to escape. For example, in my case, I didn't know that Cayman was so close to Cuba.
Oh, okay.
Not even that was three islands.
Yeah.
So when I reached in Cayman Brac, there is a CBC officer there. I remember I was in my boat and I said, hey, here in Cayman you can apply for a political asylum. He said, yes, you can. So after 3 hours, he came to us because he called the government here and said, yes, you can apply. After that, we landed. They was in the COVID time here, and they make all the proof and check our health. After that, they take you to Cayman.
Grand Cayman.
Grand Cayman, yes. Until we are waiting for the process.
So you've submitted your application already?
Yes, a long time ago.
Okay, so no decision yet?
No decision yet. The decision come from the director of CBC and say that he refused was denied.
Yes. So you're appealing?
Yes, but what I did, I remember sent two letters by box and Gmail to Clifford. Is the name of the
Charles
director.
Clifford.
Charles Clifford, yes. I not get the answer yet.
And when did you send those? How long ago?
Well, the first one is more than 1 year. I even go to his office and spoke with the secretary and not get answer yet. So because basically when I came here, I have proof in my phone. I record the conversation with the authority Cuban. And when I go to the interview, when we arrive in the island, CBC take off our phone and our ID because they have to clarify if you are Cuban, if you are not.
Yes.
We understand that.
So you came with ID? You had ID?
Yes. Only two people here don't came with ID.
Okay.
The rest, everybody come with a passport and a Cuban ID. So when I go for the interview, for the political asylum interview, I say, hey guys, I have in my phone, the phone that you took. I have the record voice and all the thing I need. It's my proof.
Because they kept the phone?
Yes, they kept the phone. So in that moment, they say, we don't find your phone. We're gonna make the interview with your phone. We do the interview with my phone, and they give me the phone like 3 days after that, and say, if you need, you have to take out your proof and bring it to us. Every first of month, I go to immigration and you ask to Neil, that is the person that deal with us in the front. I say, Neil, I have some proof there in my phone. When you gonna check out that proof? They never did. So the director of CBC take a decision with analyze all my proof. And that's what is happening with a lot of process of asylum here. That we do have proof, but nobody is like nobody analyzed the proof. Only say refuse, 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 and refuse. Go to the appeal tribunal. When we reach the appeal tribunal, the appeal tribunal is you make like a appeal application again and explain everything, and they send that to CBC, and CBC read it, and they give you a letter back to the appeal tribunal explaining why they refuse you.
Right, they have to give the reasons why.
Yeah. Imagine when I read that what the director said, why he refused my application. Said that I was in the military service in Cuba in the year 1993 to 1995, but I bought in 96. So how is that possible? Another thing is, he said that I went to the military service, but that's not true, because I grew up like Jehovah's Witnesses. We don't deal with arming stuff and that thing, so that's impossible. That's a lie. So we are changed my declaration. You know what I'm saying? Therefore, I wrote and I spoke with Manderson. Yeah, and Manderson was the person that told me, you need to go to the tribunal and appeal. Therefore, I went there. I wrote the letter for Clifford, and Clifford never replied to me, because I'm explaining, hey, Mr. Clifford, I think that you
confuse you with somebody else.
Yes,
maybe.
You confuse me with somebody else, because you can say that you analyze all the proof, because I have proof that you never accept for analyze. You understand? So I think that I need a second chance, and you take all the proof and analyze. That we know that the political asylum process takes long. The more that can take 5 years, no more than that. I have been here 2 years, but there is people here that have been 10 years, 8 years, waiting for that. Wow. And we know that the life is short. So it's not easy when you have you are young, maybe you want a family, but you don't see a clear future for you. That you see that you spend day after day, the sun come out and come on down, and you see what is happening with me. Right. What I'm waiting here.
Yeah.
That can make you like a stress in your person.
Yeah.
That make you feel really bad. It's a kind of feeling that I can describe to you guys. Yes, it's very bad. So I read some comments in your broadcast. Some Caymanian think that we like no appreciate what they do for us. Yes. No, we do appreciate what they do for us.
Yes.
Because some of them, of my friend, they was found flip over on the sea, and they rescued on the wreck. So we appreciate what Cayman do for us. It's something that I have plenty Caymanian friends here. Every day they hey Primo, because they call Primo every Cuban. Hey Primo, how are you? I'm good. They coming, we playing here football, we playing basketball. Yes, and they are very nice. We are not the kind of people that trying to make us some problem. No. We are not that kind of people. Yeah. I know for sure that some Cuba, they did bad things in the past. But even the Bible says that you cannot use everybody in the same way. Yeah.
I think one of the problems is like when you guys go and protest on the government steps, people don't like that. They see that as showing that you're ungrateful.
Yeah.
So it's the way that protests.
Yeah, we understand. Miss Sandra, for example, if you come to put in the same situation than us, we try to speak with the CBC, we try to speak with the government, we try to speak with the human rights, and nobody listens you.
Right.
Nobody listens you. So for the protest, if we go to there and try to speak with the police and the department that give you the permission for doing the protest,
yeah,
the first that they ask you is your ID, because have to be a responsible of the protest.
Yeah.
We don't have ID. Or ID, all of them, CBC have it.
Wow.
So how we can get the permission for protest if we don't have ID?
It's clear.
Yes.
You see? Now, that is we don't want to like stress the Caymanian people and thinking that we are ungrateful and that we can that we want it like they pass for a bad moment or nothing like that. One more thing is that I'm not a leader as some people say. No, I'm only the person that learn English first than other. The other, they know some words, some phrase, but they cannot understand a whole concept, when a whole conversation. So that day, when CBC came, I said, "Hey guys, we are not here for troubling nobody. We are here because we wanted that somebody listen. What is happening? Why we are here?" So basically, what happened that day was the CBC came a lot of time. They came by 12 noon, 12 a.m. middle of the night, 3 in the morning, and they come here to look some people that they escape. We know that if you escape from detention center, you're wrong. You broke the law. They have to catch you and they have the right to send you back to Cuba. That's okay for us. No problem at all.
Yes. And those people came here to stay.
Yes, yes. That was the security told me that he saw those guys down there. So you can come and you can do your job. We're not gonna interfere with that.
Yeah.
But there is a way that you do the things. For example, because if I go to your house and it's 3 in the morning, maybe you sleep with clothes. Other people don't sleep with clothes because they don't like it. So come, if I make my process, I'm not breaking any law. Why you have to treat me like I'm a nobody,
Yeah.
like a...
But I think the problem is because it was a raid, right? But then the way this place is situated, it's hard to do a raid without impacting everybody.
Yeah.
You know what I mean? It's
But what I make upset everybody here, that we go out, they knock the door but harder in the rough way.
Yeah.
And they take you out. They have like a picture of you. I say, okay, you are in the process. You go
Yeah.
out. You go out. But some people, they don't have chair for cover. And outside, 4 in the morning, was cold that day. Very cold. Well, imagine that the same day, rain here in Boston town. We go out and we stay there maybe 1 hour or more. Outside everybody, waiting until they finish. So they catch a boy here and they take it almost naked outside for detention. I take my own shirt and my teacher and say, "Hey officer, give it to him. It's not right that guy is no shoes, no shirt, cover his head." And the officer said, "No." I said, "Why not? If he's right, he's a human being like you and me." He refused. He don't want to accept. Other officer came and explained to him, and I open his hand and I give you my teacher. I say, "Give it to him, please." And the same attitude, they don't want to listen to nobody. I say, "Okay, I want to talk with you, with who is in charge, with the boss, because this is not properly, not even for me, not even for that guy that is with no teacher, no cover, and it's cold outside." We go down upstairs. We knock the door. All the door was closed, and they was inside searching. Maybe looking for someone else. So when we knocked the door, an officer came, opened the door, and say, "Hey, officer, can you give me one chair? I give you mine to the guy that you arrested." What they did, they bring me a dirty chair. I don't know where they find that chair, but they're gonna give me a dirty chair. Use this one. I say, no, how you think I'm gonna use that one? Who is the superior? So a lady that I have to say thank you to that lady that is a CBC, the young one. I explained to her, and she went to my room and she bring me a cover for me. Very nice. She was very nice with me. But when I tried to speak with the person in charge, they closed the door again, and they just run into the car, and nobody wanted to talk with us. The car just run and left. So maybe it's the stress, maybe it's the bad way and the rough way that they came, that they think that you, or the only that you deserve is this dirty chair, use that one. They say, okay, we have to do something because it's not the first time, it's not the second time, and it's not the third time. There is a lot of time that they do the same. When we go to sign, we explain to the person there that speak Spanish, hey, why you come to this time? Why you have to be so rough with us? Because I'm a person here that I'm not breaking the law. If you and me go right now to immigration or the government, they can we ask, hey, how is Nadir with you guys? And everybody, I'm sure that he gonna say, and she gonna say, Nadir is a good guy. Nadir is the person that love and do the properly thing in the right way. We don't have no problem with nobody here, but I'm not telling you that maybe some Cuban guy have a different concept. They do another thing. Yeah. But they no can take you for the same kind of people. There is a lot of people here. There is kind of mentality, you know. That is something that I would love that you sharing in your broadcast.
Yeah.
Yeah.
We'll let people hear.
See, and one important thing is I know for sure that there are a lot of Cubans. They don't know about the laws and the process.
Right.
Why? Because we came from a communist country. So in the communist country, they only teach you that you only have to do what the regime said. You don't know about the speech right, the religion right. You don't know nothing at all about that. So maybe for that, some Cubans, they don't understand the way to approach to authority and speak with them, or even speak with the person like a regular day. Hey, how are you? That kind of thing is kind of complicated for Cuban. But the other thing is the misunderstanding that sometimes for different culture we have.
Yes.
Yes.
Because I was even telling her earlier when we were there on Tuesday with the protests, right? You know, people were getting very, maybe like emotional.
Yeah.
And speaking loudly and whatever. And I was trying to explain to them that like most Caymanians would see that as aggressive behavior.
Yeah. We speak like relaxing.
Yeah, you know, and maybe like you said, culturally, maybe in Cuba that's not a big deal.
That's normal. Even the people play like moving the hands low, and it's normally. It's not that they gonna attack you. It's not like that.
Yeah.
No.
So I think it is a lot of misunderstanding.
Yeah.
Like the one guy, he's like, oh, you know, CBC is trying to kill him and this and that, and I'm like,
yeah. We also have to realize, as I told you before, that there is a kind of different mentality here, and maybe could be that person don't have all the sense. Maybe the long time, because that person have been here almost 9 years already. He getting affect mentality. You understand? So there is a lot of main points that every person have to think about that more detail that can make a lot of difference. A lot of difference can make.
I understand.
So, for example, a lot of people here, they explain me also that they don't. It's not that, like they don't want to come and that they are ungrateful and say, "Hey, we don't want to be here." No, it's not like that way. It's like the way if we know that Cayman is a small island and the resources are limited.
Yes.
We know that. So what they say is, if Cayman government cannot support all the migrants that they have here, don't lie to us at the beginning. Because when we are in the Cayman Bra, in our vessels, we ask from the vessel, we can apply for asylum here.
Yeah. But remember, application doesn't mean approval.
Right. And even to my friend, I explain, when you apply for something,
yes, they
that
can deny
doesn't
it.
mean that the government has to give you the approval.
And I think maybe going forward, I'm going to speak to CBC. They need to explain that.
Yeah.
That yes, you can apply, but that doesn't mean you're going to get it.
Yes.
You know, because
exactly.
probably only a small percentage of people get it anyway, and then you have to end up going back to Cuba.
So, I give you. We asked a lot of questions to CBC, and CBC never replied to us. For example, all that happened, we don't get an answer yet. We don't get an answer yet. The only thing that they did was take him to me because they think that was like a kind of leader. No, I'm only the guy that can speak English properly.
So he was the one that was taken.
Yes.
Yes, they take me. They arrest me and put a handcuff here. Yeah, and they cut me. My legs here, I have a scratch. Yes. They was rough with me without no reason because I was with my hands up. You can saw in the video.
Who was in the video? Who was cursing and stuff like that? When the CBC officers came, I heard some people using some profanity in Spanish, and that wasn't you.
No. I not use a bad word. No, never I use bad word. So when we are there, the first that came was the police, Cayman police. Very nice guys. They say, hey guy, what is happening here? We explain the situation. They make a report, and they say, okay, we're gonna explain the law. They never said that we cannot stay there. They only say, okay, look, you cannot use the post and put it in the wall because this is property of the government.
Yeah.
They'll say, okay, so let's take it. Everybody take the post from where we hold them. So other thing, when the people start to coming, you cannot be like in the middle because they have to come in the building, in and out, back and forth. Okay, no problem. So you can stay in the
on
left,
the side,
on the right. Okay, we do all that the police say, and we don't have any problem with the police. But when the CBC director came to us, he not came with the same diplomacy. He wasn't professional. The only he said was, okay, I want to talk with you and you. No, I'm only the interpreter. All the guys have a lot of things and complain from you. Why they cannot hear, why they cannot speak with you.
Okay, folks, I'm going to pause it there because I do want to play the rest of it on tomorrow's show. And we're also going to make this, we'll air it on social media as well for those of you who will want to watch it separately. Here's my thing. I think that there are a number of things that have come out as a result of this. Number one, the conditions that these people are living in at the Civic Center is simply not acceptable. You can't create, I see some of your comments like, how is this our problem? You know, they should be cleaning themselves, this and that. Listen, I agree with him. If you have $160 a month and it's a card that says you go to Foster's, and I've never had NAU assistance, but my understanding is there's only certain things you can purchase with that card. Not everything in the store are you allowed to purchase, right? So it is designed really to be a food card. Now, I don't know. I mean, this is a question for NAU. Can you get cleaning supplies and other stuff with the food card? But primarily, it's a food card. How many of you can eat and buy groceries for $160 a month, and that's going to feed you for an entire month? I'm just saying. We have to be fair, right? That to me, this demonstrates a lack of fairness, a lack of proper processes of how that civic center is set up, and a lack of humanity. You can't take 40 plus people and put them in an open space and be like, okay, each one of you gets a little cot and you just sleep on that for years. And that's going to be how it's going to be. And that's acceptable and that's okay. I mean, I can't imagine it. I see someone commented, I think it might have been Hunter. It looks like Hunter has flipped the switch on us today, and his position is completely different than what it was last week. But he's saying we have plenty of Caymanians living like this too. Hunter, you can't show me anywhere in Cayman where you have 40 plus Caymanians because of government living in this type of a situation. Show me where that's the case. Show me where the Cayman Islands government has taken 40 plus Caymanians, put them in the Civic Center. What's the square footage you think of the Civic Center? And said, make do with what you have for years. This is the kind of nonsensical conversation that you guys have got to stop engaging in. This is deplorable and it is inhumane. What did they expect to happen when you have that many people in a situation like this? They're making do with what they have. You guys saw the photos. You saw the pictures. They're going out there getting trees and building up into the ceiling a little divider to be able to hang a door, put a little padlock on their door because they don't want people stealing their $160 worth of food. How many of you Caymanians, no matter how bad you have it, are living like that? But let's be very frank and honest here. Step forward, because I would love to hear from you. Where you have another 40 people that you have to use a shower with and one toilet facility. One little kitchen space. Listen, there has to be a better way of doing this. I am absolutely flabbergasted. Somebody says, oh, you can buy whatever you want with your foster card. This isn't a foster card. This is an NAU card. Someone said the Civic Center is just about 1,500 square feet for 40 people. Once again, I ask the question of how is that even permissible? Where is the Cayman Islands Fire Service? 40 plus people in 1,500 square feet breaks every single code, every single fire code that I have ever heard of. Now, we have asked CBC for an interview because there's a lot of information, misinformation that is in the public domain. And this is where we're going to do a singular interview. We're going to break down the law, and we have got to get this straight in our heads. I have read all of your comments, and I see what you guys are saying. Oh, send them back, send them back. We can't. There's an actual process on how to send them back. When the law was changed in 2022, it made it easier. And that's why CBC, every time they put together a flight now, they're sending back, right? It made it easier for those that have come since the legal changes to be repatriated back home and to sent back home. These people were here before then, and they had applied for political asylum, so they have to go through the process. We are not in a position where we can say, oh, just put them back in a boat and just push them out to sea, and that's going to be it. Magdalena asked a very good question. How can we as a community assist them? I think that that's an ideal question, Magdalena. And in fact, I told them that I would bring them some cleaning supplies, right? You'll see later on in the interview how the woman's like, she's been here for over 20 years. She will come and help them clean and this, but if they don't have the supplies to do it, they're not given garbage bags, they're not giving anything. I'm like, come on, let us be fair. Garrett says $106 per month that feeds you for a week in Cayman if you eat a cracker a day. There is surely a better way of organizing the Civic Center. This should have been done before they made all these little makeshift rooms. There could have been a better way of allocating a food budget and having someone cook and feed the whole group. I mean, to me, this is just unbelievable. What I saw at the Bodden Town Civic Center really hurt my heart. This is a problem. Now, what led to the situation last week is two who were at the detention center. I'd like to see what the detention center looks like. They ran from there and went to this facility. Does that mean that this facility is better than the detention center? I mean, you have to beg the question, right? And they're not supposed to leave. Yes, they were considered illegals because now, you know, they've escaped lawful custody. So they're not supposed to leave the detention center. So that is why the place got raided. But like the guy said, okay, you're coming looking for these people. Somebody said the detention center is a mess. Really? Well, Bon Town Civic Center is a mess. How much worse can the detention center be? Mold and water coming from the ceiling. I mean, come on. None of this is acceptable. Doors broken, all that at the detention center. Wow. We can't treat these individuals less than subhuman as long as they are here and, you know, receiving or going through the process, whether they get denied or whatever the case may be. And there is in law a process. And I think that one of the things also that is happening is that there's a lot of miscommunication. So for example, when they were told, yes, you can apply, like he said, in Cuba, they don't have these freedoms and all this kind of stuff. So they don't understand a lot of different things. So when they told them, yeah, you can apply, I'm sure a lot of them assume that it's going to be easy for them to get political asylum. They really need somebody to break it down to them and say, listen, you have a right to apply, but applying does not mean you're going to get it. And it is an arduous process. It's a difficult process to go through. Because think about the perspective of these people and what it is that they must be thinking. They've been used to the dry foot, wet foot policy in the US. The second they touch American ground, they're good to go and they're right into America. That is not the policy that we have in this country. So I do think that when they deciding you're going to come on board and you're going to start this process, they need to understand, like he said, this plays with their head. This is mentally very, very distressing to them to be in this holding pattern for years and to live in these sorts of conditions. We have got to do better than this. This can't be who we are as a people. Setting aside all of the other issues of whether you want them here or not want them here or whatever the situation is. Once they're here and we are responsible for housing them. And you'll see, I talk about later on in this video, we'll play the part 2 tomorrow, talk about how, you know, listen, the truth of the matter is, you know, Cubans have been put in housing and they destroyed the housing. And they're saying, yes, that wasn't us necessarily. Those were other people. And we now recognize that we are ultimately going to pay the price for every single Cuban national who has come here and done something wrong. Caller, good morning.
Good morning, Mom.
Morning.
The topic is so hurtful to hear about all of these things. But at the same time, you got, as other caller had called in or email you or whatever, saying about Caymanians got it hard too. Well, I know for sure some Caymanians got it hard, but I don't think it's like that.
No. I think this is where we as Caymanians are happy to be disingenuous because we don't want to do the right thing. Like I said, I challenge anybody outside of Northwood Prison to show me any location where 40 Caymanians are in less than 1,500 square feet of space together with one kitchen, 2 showers, and a toilet. Nobody gives them garbage bags. They get $160 a month. Even our so-called Caymanians that have it the worst, NAU is paying all $1,800 a month for them to get an apartment.
Yeah, it's true. I used to work public works way back in when the Cubans first started coming here by the bunches. Breaker Civic Center used to be in a bad mess with them. I saw several civic centers and things that I saw was unbelievable. But at the same time, I had to go in there and do work, make sure the lights working, stuff like that.
The AC vent, listen to me, an AC vent that has not been cleaned in years.
Yeah, they get sick off of that. That's mold. But anyway, it's sad. All we can do and my family can do is pray. But we have a bunch of whatless government. It's only
well, I think we need to do more than pray. We really need to hold these people, hold our own government accountable for this.
Yes, we only have a handful of the 5. Not all the 5, that I talking about is good.
Mhm.
One or two, or 1.5, or a half of one, whatever. I know what I'm talking about because I'm a raw Timanian.
Mhm.
And at the
Mhm.
same time, the subject is not what I talk about right now,
Mhm.
but the police force is sickening, and what's going on with this little, well, what the old people would say, little inmanly little boy, little him, he not got no manners. They about talking about they want to go shoot up your family if they can't get you and all this thing. You know what you got to do with all of them? Put all of them away.
Mhm.
Do even sentence them. Just keep them there for a while. I know, I don't care what anybody say. When they go on bad like that, you have to do things. And the police is scared of them. But well, you can't be a police if you're scared of people.
Mhm. Mhm.
What you getting paid for?
Yeah.
What you getting paid for?
Mhm.
Just to say you getting paid and can drive up now in an AC car. In me and my wife come in from work a few days ago, and it was so close that we see a police car stop for these two Spanish girls and put them into the car. All those kind of things not supposed to be,
Mhm. Mhm.
because they look good, they look straight hair, they look this, they look that, and he stopped for them and he was smiling up with them. My wife said, "Look at them, like he know them." Putting them in the car. We he took them. But you see, so much corruption going on in Cayman that we as raw Caymanians keep our eyes closed and our hands out.
Yeah. Yeah.
And it's so sad because I know why I'm saying. And the next thing is, I don't know why the police can't be done by early roundabout, early in the morning, about shift changing. Get some traffic cops out there because someone gonna get hurt by racing in the morning. These construction workers and these little Audis and this little Honda Fit, the racing. They be cutting off me and my wife and we come in work in the morning, 6 o'clock. Cutting us off. So where the police is, they're sleeping. They gotta get police around the place, walking or back on bicycles. They gotta do something because it's terrible.
Thank you,
It's terrible. It's really terrible. And you have a wonderful day. And
Thank
all
you.
I pray for that we can get back, Cayman. Because it's never too late. Never too late. The rope has, you can have a long rope and you can have a short rope. But it all has an end to it and then a middle to it.
Thank you, Carl. I
And
appreciate
like
it.
what the old people say, when you go to the well, how much trips you're gonna make? You never know when the bottom of the bucket gonna drop out.
True.
Yeah. Like what the old people say, like leaders for all Caymanians. Them little fops talking about they got guns. What they need, some really good citizens with some good hardcore police to go around every place and raid every place. But you can't ask them about turning the guns. They're not gonna turn in no guns. Guns come in here by the millions. When the police sleeping, the guns is coming.
Yeah. True.
Well, anyway, yeah, because they get tired too. But that's no excuse.
Yeah.
That's their job.
Thank you, Carl. I appreciate it.
Okay, and you have a wonderful day.
Thanks, you
Bye.
too.
Bye.
Oh, it's a hot mess and then some. I tell you what. I don't know. It's really sad. And saying things like, oh, well, they got it worse in Cuba and this and that. I mean, last time I checked, this wasn't Cuba by any stretch of the imagination. So, we need to do better than this. This isn't who we are. Good morning, caller.
Good morning, Aunt Sandra. Good morning, Cayman Islands.
Good morning.
It's a blessed day. Yes, this is a hot topic. I agree with the caller, what he's saying towards the police. We need to have more traffic cops on the roads in the morning and afternoons, especially by the schools, especially your small community areas, especially where they picks up where the school children is too. There are predators out there. People be aware, please. Be aware of your surroundings. It's not a joke. Time coming. Times are coming like these, and these are dark days now. So as I was saying, let us touch the topic on top the civic centers and them. How come they are not walking around maintaining these facilities? Why it take government so long to maintain an AC at a school that children have to complain? Back when we were growing up in school, we had windows, we opened them, we still get our work done, but I don't want fancy school and close up window and everything. Your child can't breathe. They're wondering why they're sick. Every minute they're sick. Maintain the facilities at every single place, public, beach, cemeteries, everything, the civic centers, the football fields. You take the football stands down all night, you can't put them back up. Everybody standing up on the sidelines, side the hole inside the fence and everything. We looking like chickens, come try and get inside the game. We want proper seating, can't do it. You still can't maintain swimming pool in Cayman Bracket Green. What is going on?
Yes, but they still want to take another $50 million and build something else in the bracket.
And
not
then
gonna
you
be
want to put
maintained.
$50 million for school? No, sweetheart. If you can't maintain 2 schools down in Grand Cayman, why you need a third one for? Why is you wasting Cayman and my money for on foolishness that you cannot maintain? What? So you as a government leader to bring down brand new car to ride around with your mistress and your side pieces. Enough is enough. And they need to wake up, stand, put on a foot down like how them Cubans protest at the government building. It is disgusting. They're putting 10-story hotels up like you're crazy. You can't even see the sun or the sea water no more. You got Great Wall of China across Cayman. It is disgusting. You're destroying your island. You're destroying your culture. You're destroying the people mentally, not physically, mentally.
Thank you, my dear.
It is hurting. Have a good one, my son.
Thanks. I appreciate it. I mean, it's a sad situation, folks. And there's a lot of suggestions on how this could have been avoided and how this could have been fixed. And I'm surprised that no one came up with a more viable plan than to throw all these people together. This person who works in the industry said that this is definitely a fire hazard. They said the facility is in a state of major fire hazard, especially considering that people are smoking indoors, AC units not being, properly serviced. It's shocking. I mean, I'm flabbergasted really at what I saw and what I witnessed, and what I'm sharing with you guys now is it's unbelievable. Good morning, caller.
Good morning, Sandra.
Good morning.
You're talking about traffic police. Do we have really traffic police in Cayman? The question is where they are. I see 2 riding bikes. They go to the public beach. Those 4-wheel bikes. They're watching the woman with bikini there. And in the evening, there is traffic. We don't see one police car directing the traffic or doing something. The other day, I was
someone is asking if you could stay on the topic with the Cubans, because we really weren't talking about traffic, to be honest, and we do need to wrap up the show. But we can talk about traffic another day. I don't want us to really get off on that topic. It's an important topic, but really.
No, but I just want to say one thing about this subject.
Yes.
The other day I was in the, those crosswalk, the one in the public library. Somebody driving by his car, and I am in the cross in the red line, to cross to the park opposite the public library in Georgetown. The car hit me, injured my foot, and the driver just looked at me and gone. I called the traffic 911. They make the traffic call me, and then the woman said she have dental appointments from the traffic department and she can't come today. She will interview me tomorrow. You imagine that? I am injured, my foot is injured, and the man hit me and ran, and until today, I don't see the police even call me back. So this country don't have traffic department.
Okay.
That's the issue. About the Cuban, I think we need to look at the issue, that if there is a place, human, like, respectable place, those people, we can place them. There is agreement to return them back to Cuba. They are not coming to stay in Cuba. They are going to United States. So I think the government...
I mean, to be clear, if they weren't trying to stay here, they wouldn't be applying for political asylum. So we need to, this is why I'm having conversations with them so I can understand exactly, instead of us assuming that we know what they want and what they're doing, have conversations with them so they can be very frank. They were told, and again, I think this is a communication mistake on the part of our officials, they were told, yes, you can apply for political asylum. But in their minds, they seem to think that that means that, yes, you're going to get it. And so that should have been communicated very, very clearly to them by the officers who interacted with them. And let me say this, we're going to continue this conversation on tomorrow's show, but we also need to be having ongoing conversations and dialogue with them to let them know what the position is, what the law says. It's like nobody seems to talk to them. And this I found in a way very, very disheartening. What is wrong? What is wrong with having, even once a month, some representative going by there and saying, listen,
why we don't allow the people who given food for the boat, the Cuban boat and water, to continue their journey?
Because once they're in Cayman, this is what I said, Amjad, I need you and everybody else who keeps asking that question to pay very, very close attention, right? The reason why I want to sit down with Charles Clifford and his team is to get them to explain and answer these questions, because there's a reason why we cannot do that. It is not an option for us once they are in Cayman waters. We have to take them on board and start processing them. Once they're in Cayman waters, we can't give them food and water and say, be on your way. We are not permitted to do that. So this is why it's important.
I agree with you. International law.
I mean, it's not agreeing with me or not agreeing with me. It's what the law allows us to do and what it doesn't allow us to do. And we need some clarity on this, because people keep saying the same thing over and over again. It's like a broken record. Why can't we just give them water and whatever and put them on their way? The two main reasons for it is, number one, other countries that they end up in would be blaming us for being like an enabler and getting them to their jurisdiction. Well, you're the one who gave them water and food and whatever and allowed them to travel to Jamaica, the US, whatever. And we could get in trouble for that. Just like our national airline. Remember how Jamaica said they were going to stop them, using their country as a trans-border area, right? And then our plane gets stuck in Cuba and Jamaica because of the policies of these other countries. So that is not permitted. And this is the thing we have to understand, what the rules are, what's permitted, what isn't permitted, and why our government is acting in a particular way. But despite those issues, despite those, we'll get to all the explanations there. If we're housing them here, how can we house them in an unsafe environment?
I think inviting Mr. Clifford to clear all of that, I think we have a...
Well, we have invited him. He's supposed to get back to us. We've invited him to have a sit-down interview with his senior team and to explain all of this without any interruption. So we're going to do a pre-recorded interview. We're going to go through the law, have them explain these things to us. Why is the law this way? What international conventions are we subjected to? All of that is on the table for questions. I just need Charles Clifford to confirm with me the time and place, and I will be there. Have a good day, Amjad. And by the way, Amjad, I was trying to get someone else to call you last week. You said you were trying to get through to people in the health ministry, but they don't seem to have a number for you that works. They said they were calling and your number doesn't work.
Oh, my phone get damaged this week. So
well, they were trying to call you, but yeah, they couldn't reach you. So if you can send us a different number, maybe send it on the either the WhatsApp or the messaging, I'll pass it on to them because they were trying to call you.
I'll send it to your Cayman Marrow.
Okay, great. Thanks.
All right, Sandra, thank you
No
for
problem.
your program.
Okay, thanks very much.
Thanks, bye.
Yeah, so this is my thing, right? I mean, I see people in here talking about they want to run for public office and just send them back, just send them back. You cannot say those types of things if the law does not permit that. We have obligations, both international and the obligation to follow our own laws. Yes. And there's certain things that we can change and certain things that we cannot change. We need to be very, very crystal clear on what the legal position is. Because even within their own group, some of the Cubans are saying, oh, we have a right to this, we have a right to that. And I'm like, no, you don't. Misinformation and lack of knowledge and lack of understanding is one of the critical things that will always hold us back as a people. What I'm saying to you all is, despite all of that, yes, if you're going to put people in a civic center, how can you rightfully put 40 plus people, including women, in a civic center with nothing in place to properly house them? We're going to see one guy, he's on crutches. So they had to make a makeshift area for him to try to compensate for his situation. Communicable diseases. You know, that's why when they get the chicken pox, it's no wonder that it spreads quickly. These are the, listen, I'm saying that the conditions that we have these people live in is subhuman and just completely wrong. I know for a fact that there's never been an elected official that has ever gone in there and saw this for themselves, because they would be moved to ask some questions and to do something about it. If we're going to spend $3 million per annum on these people, I need a breakdown of where that money is going. We could have set up that civic center better ourselves, retrofit it and fit it out better where it looks a whole lot better than that. Make sure that there's cleaning supplies available. There's garbage bags available. You know, there's no laundry facility. There's nothing for these people. Y'all saw the condition of the kitchen. Each man has to lock up his own food. You see how they have their little stash of food in their rooms. They're afraid of people stealing from them, right? Some people donated electronics that isn't working. They try to fix it up. We see wires. Let me show you guys, because again, look at this. Electrical wires hanging all over the place, right? Tree stumps have been utilized and used pieces of plywood to try and create these little rooms. Come on. If our government had taken it upon themselves, Public Works could have done something better than this. This is a real hazardous environment in which these people are having to live. And not to mention that the civic center has been ruined for all intents and purposes. AC units and filters that have not been changed in years. Come on. Right? People will donate and give them stuff. So here's one of a old used what do you call it? Deep freeze. And they kind of store their meat and whatever in there, put their name on it, store their meat and hope that somebody don't steal the meat. They put a padlock on it. Because again, I mean, I don't know how many y'all eating on $160 a month budget, but I'm pretty sure looking at the size of most Caymanians, that not the case. So this is how they're having to live. See, this guy uses his little shoe rack up at the top there. That's where he puts his shoes. Someone said to me, Sandy, you know, despite these people living like this, they have, you know, interacted with them. They've seen them out. They must say that they're still clean when they're out. They're still put together. It's not like they're stinking and they, you know, walk around disheveled and whatever. But look at this. Look at this. Y'all don't see how this is a hazard? How this is a problem? I don't know. I don't know. Again, the excuse is, oh, well, we have Caymanians living in bad conditions too. Really? Here's the thing that somebody just said. The difference is Caymanians have the opportunity. Caymanians have something these Cubans don't really have, opportunity. So Caymanians shouldn't be in the same boat as these refugees. A Caymanian can get up and go to any job site that will hire them and work. These Cubans by law cannot work. So for those of you suggesting, oh, make them go out there and work and earn their keep, the ones that are working under the table, now you see why they might want to be able to afford to buy clothes and other stuff. No, that channel, yes, it's $160 per person that they get an NAU card for food. Miss Aline says that's in Cayman. No. So this is it. I think we need to be fair as people. Okay? I'm not here to be unfair to anybody that I can really help it with. Even with our politicians, I'm fair to them because I only tell the truth on them, the hot mess that they're in. If you're interested, there are church organizations that they have said. Some of the churches do reach out and try to help them. They said some of the guys come there at the play field and they, play basketball, whatever. Sometimes they'll bring them stuff. They might have a little barbecue outside. I think that, a lot of people, I wouldn't say a lot, but some people have understood their plight and have reached out to them to offer some assistance. That being the case, I'm going to really implore our government to step up to the plate and answer some of the tough questions that this situation has created. I'm happy to donate some supplies. I think that even the way that the food is being done, yes, giving them $160 a month for food vouchers, but you could have done almost a community meal setup situation where they could eat 2-3 times a day out of a pot of food, and it would be more economical and it would actually work better than this. Ms. Aline says people need to drop their old pop down stuff if it's not working and don't give it to another human being. You can help. And I think that some of you are minded to want to assist and to want to help. That channel, yes, says, how can we donate and bring stuff to them? This wouldn't be seen, as far as I know, there's nothing illegal or wrong with that channel. All of them at some point will have to have their application dealt with. I'm also at a loss for why it's taken so long once they appeal. The process, on the one hand, people are saying, well, they shouldn't appeal. But you heard what the guy said. His application is claiming one of the reasons it was denied was because, he was in military service from this year to this year, and he was not even born yet. If you were in a situation, wouldn't you appeal that? Somebody has denied your application, and it was denied on the basis of misinformation. I would appeal that too. I wouldn't accept that. So listen, if the law permits them to appeal and they go through the appeal process, what we need to do is expedite the appeal process. Those 40 people that are there, that should be dwindling very, very quickly. You either get political asylum or you go. 90% of them are going to go, and they're not going to ever be successful with a political asylum application. Let's get the ball rolling. Let's stop fooling around with this. This is a hot mess and then some. I cannot accept that as a so-called, y'all claim that we're a Christian nation, that what y'all claim, that this is how we are treating people. And these are the conditions that our government, not private sector, our government is allowing people to live in, and that is okay with our people, the government, the human rights organizations, our churches, anybody who is community minded. Yes, we've got churches, we've got NGOs. Even Shaka Zulu says, what about the Cuban diaspora here in Cayman? They probably don't even know that these people are living in these types of conditions, because let me be very, very clear. No one has ever had access to this facility before. And you'll see later on, I think we got that part recorded, where the security guard comes over because he thought I was about to go in. Mind you, I was wrapping up, and said to me, oh, you can't go in there. And I was like, I've already been in there. I don't know what you're talking about. Been in there, done that. Don't know what you're talking about. Of course, they would never want anybody going in there and seeing this. This is a blemish on us as a people. This is horrific. My God. It's just not right. Well, guess what? The cat is out of the bag now. We've seen it. That channel, I am personally going to take some cleaning supplies. I mean, my God, I think about how much money I spend just on cleaning supplies alone and garbage bags and all this other stuff. I'm going to donate some of what I have. I'm not even donating what I have because I got my own cleaning supplies from my own place to try and keep it clean. I'm going to go to the store. I'm going to go to Cost You Less and Price Right today and buy them some garbage bags, some gloves, a lot of bleach, because that place needs to be bleached out in the worst kind of way. But even so, somebody from Public Works needs to go and change the AC filters, service the air conditioning, something. Come on. The government now needs to look. Juliana O'Connor Conley, the biggest Christian in all of Cayman. Yes. Okay, you're not here because you don't believe we need emancipation. Fine, whatever. Can your government commit to doing something about that civic center? Y'all have destroyed the civic center by allowing this to happen. What did they think? Let me just ask y'all a question here. What did they think was going to happen? You throw 40 people in an open space together. What do you think they're going to do? Just all sleep on the floor? All sleep on a cot for years? It doesn't even make any sense. Like, surely they could have foreseen that this is exactly what was going to happen. They should have monthly inspections where they go through this facility. They don't even know what's going on in there. There could be all sorts of illegal activity. They would have no clue. They should go in there monthly. There should be monthly inspections. They should be communicating with these Cuban people on a regular basis. They should have expectations of them like, okay, we're going to set up a facility for you in terms of, give you your little sections and whatever. There's certain things that you can and you can't do. You can imagine trying to share two showers with 40 people. The man says sometimes in the middle of the night is when they have to go and shower because the line is so long. Everybody trying to get a shower before they go to bed. And those of you talking foolishness in my ear hole about, oh yeah, well, Caymanians live in these conditions. Show me where are those Caymanians living like this that don't have an opportunity? A good number of our people are living in the conditions that they have created for themselves. It's not that they can't get out there and go get a job and do better. So you're not really comparing apples to apples, to be fair. And even though these people are not permitted to work, some of them still go out there and take the chance knowing what it could do to them and work because they can't realistically do much on $160 an hour. I mean, $160 a month. Siobhan says misinformation that they don't seem to care about. China says, but it is them, the Cubans, who have the place or civic center looking. So this place never had looked so tell government put them there. Please bear this in mind. But China, I again ask you the question. They have done the best with what they could do. They don't have anything, right? So you see all those doors and the very tree trunk used to go all the way up to the ceiling to create like a frame where they can put in a door. All of that stuff, they've gone out there and sourced them out in the bushes, or somebody has given them a used door or whatever. So you're asking the question of why they have it looking like this. Ask yourself the question of how they got it in the first place. What they got was an empty space with some cots. They have tried to make it, since it is their home now for years, they have tried to make it into a home by subdividing and creating these little rooms with what they had. Why was that even permitted to happen to begin with? The government should have had some bare minimum standards in place so that they wouldn't have to do all of that. Do you know if the international world got wind of this and saw how these people are living? What we would have to answer to? Talking about we such a big shot jurisdiction and this, that, and the next thing. This is deplorable. If you don't have a proper facility to house migrants. Has the government ever thought, well, we live in an era now where migrants are going to be coming and going. Maybe we should build a little facility the same way they need to build housing for Caymanians. They can't continue to see these situations exist and not put any plans in place on how to address it and hope that you, the people, will remain blind, dumb, and ignorant to every single thing that is happening in this country. That's what I'm saying. CJW, good morning. It says, Ms. Sandra, I applaud you with the knowledge you have, your kind heart, your chain of thoughts, and the way you justify human rights along with the laws of the land, as well as seeing eye to eye continuously. And listen, I don't want y'all to confuse the situation at all, because I understand what Caymanians are saying when you're saying, oh, we don't want them here, send them away. I get that. But my point is this. Once they come to Cayman shores, we say we have to do this with you, okay? We have to bring you, we have to process you. We either send you back, you apply for asylum, then there's a separate process. In the meantime, you're not allowed to work. Once you're granted asylum, then you can find employment. Until then, you cannot work. That process, in my opinion, has taken way too long, yeah? So now that it's gonna take forever for them to get a political asylum, what is the process? Why are we allowing people to live in substandard conditions? Even some of the poorest people in Cayman not living with 39, 40 other people. And like I said, that's our people with opportunities. They can go to NAU. They can apply to NAU and get NAU assistance. They can go out there and get any job that will hire them, right? They can go and do the road cleanup for government and make what, $10, $15 an hour, whatever the going rate is now. They have options. These people don't have any. And as long as they're here under our watch, I think we need to provide a better set of living conditions for them. John LaRue says, have the minister on the call and ask them what is going on. Shaka Zulu says he or she does not need to be told to perform an inspection. They can initiate based on the circumstances. Damien says pine soil, scrub, soft scrub. I mean, they need everything, quite frankly. Bleach, the whole 9 yards. I mean, I'm just disgusted again by what I saw. I mean, this is, it was very hard to see this and not feel really bad for the situation that these people are in our own country. And it was also, as that young man was talking, I said, wow, in 2 years, he has pretty much, learned the English language. He's speaking it pretty fluently. He understands. He's conversational. In very limited circumstances, it's not like he could go to school and learn English. He was talking about, the mental health impact that this has had. It's, I do feel sorry for them, even outside of the living conditions. And I think we need to be very, very clear in this country about what it is that we're doing. Okay, we need to send a message as clearly as we can. Make sure the Cuban government understands. Educate your people. If they come to Cayman, this is the process. You're going to be here for donkey years and never get anywhere, live in subhuman conditions, because the truth of the matter is we don't really want you here. That's what's happening. So let them know that. Next time they show up on the BRAC and they say, oh, come on board. Yes, you can apply for political asylum. They might say, you know what? No, we don't want to do that. Yep, no thanks. Miss Joy San, good morning. She says the Bible tells us that we should treat people as we want to be treated. This is how God will bless our islands. We never know when we're going to be in need. Be kind to one another. I myself sometimes judge based on what I think and not facts. Forgive me, God. Thanks for bringing us the facts. I have not heard all, but I've heard enough. Wasn't on for most of the talk. So like I said, I'm going to finish the video tomorrow. We're about 40 minutes in. We probably have about another 10 minutes left. And then we can discuss it some more in tomorrow's show. And I'm going to share it separately if you just want to watch it separately as well. Listen, there is a way to do things and there's a way not to do things. And, you know, when I consider the amount of money that our government is spending, I don't even think that our government has gotten value for money. Where is this money being spent? We're going to ask for a breakdown, because I suspect what is happening where people are confused is the government is saying over $3 million, that's on security, paying security staff to keep them locked up at the detention center. That is on staffing and all this other stuff. That's not $3 million, obviously, that is going to the Cuban migrants themselves. And that is where, again, the conversation has deviated from what is factual, right, to what is the perception of where that $3 million is going. Dee Dee says, shame, totally understand your frustrations now. This life is the government, their life is the government's responsibility. Thank God nothing has happened in that place. Elaine says, unsanitary, convenient, strong-willed. So you imagine if I have diarrhea and I need to use that toilet. I mean, there's so many things that you got to think about. As a woman, I was thinking about, you know, let's just be honest here. Women have special needs, you know, in terms of their menstrual cycle and products and stuff like that. Can you imagine having to sit on that toilet and share that space with all these men? Jesus Christ. I mean, this is horrible. Listen, I have, how many bathrooms do I have? Four bathrooms? 1, 2, 3, 4. And sometimes my husband's like, oh, Sandy, don't come in the master bath. Go use the other one. Because, you know, you need to use it for like a specific reason. You want to give it time, open up the window, let it air out, whatever. These are the natural things that we as human beings do. Churches, let me make an appeal to you all now, right? Because y'all always in the mix when it comes to the things that you shouldn't be in the mix with. If this was an anti-LGBTQ discussion this morning, all the churches would have been, oh, Sandy, yes, praise the Lord, you tell them, honey child. Y'all are awfully silent when we need you to step up to the plate. We don't need you to just be passionate about just the gay people, okay? There's a lot of suffering in this country, and the churches make a lot of money off of the back of these people. The Caymanian people, I mean. I see you guys drive around in your fancy car. Every single time I see a church pastor in a Mercedes, I'm like, wow, I'm in the wrong business, honey child. I need to be rolling with the big boys. Because, you know, they don't pay for housing. They don't pay for that Mercedes that they're driving. They get free gas. They get everything. And they always have the crispest outfits and full suit and all kinds of things, looking good. I'd be like, Pastor, wow, look at you. We support these churches. We give people, y'all give your tithes and all this kind of stuff. Can we ask them to please step up to the plate and assist some of the people in this community? Not just the Cubans, but lots of other people could use your assistance as well. Somebody said the pastor's getting all 15 grand a month. All expenses paid for what? You think God is pleased with that kind of nonsense? You need to help the poor. You need to help the disenfranchised who have nothing and nowhere else to go. Shame, shame, shame. We need better than this for humanity. This is not acceptable. God, where is the human hearts? Miss Joyce, I'm telling you, we're elected officials. Not a single one of them has ever said we should have some minimum standards with stuff like this. Manny says, isn't it mandatory for men of a certain age to serve in the Cuban military? My point is, these people don't have a choice. So that shouldn't determine whether a refugee is granted asylum. Well, that's true. Miss Darlene Manzanera says, thanks, CMR, for going out there and highlighting. You're welcome. Miss Amani says, God have mercy if the day comes that we are so privileged as to seek refuge elsewhere. And you never know. I mean, let's be clear. You never know what the future holds. We've been in a sweet spot for a minute, so we might not remember. But don't get too comfortable. Gabby says, like I mentioned, that facility has so much back land. Why don't they build up temporary apartment complex and the others that stay in there in other facilities? I mean, it seems to me there wasn't really a plan at all. It's just like, oh, just throw them in these open spaces. Elaine says, thank God it's not like in the middle of COVID. Shaka Zulu said there's a possibility the international community will now know the CMR. Thanks, CMR. Well, if that's what it takes for change. If you want wish-washy policy, vote for Hunter. What is V4H 2025? Oh, vote for Hunter. Hashtag vote for Hunter 2025. Oh, Lord have mercy. Miss Celine says proper information is important. Thanks, Sandy. Miss Olive says, Sandy, probably you just open up a big can of worms. Well, I hope I'm opening up a big can of worms for some change. Because like I said, I've got a whole lot of questions here. Ms. Darlene says, the good thing is CMR family, we will see action by next week. Let's watch this space. Sydney says, thank you, Sandy. I was just thinking about churches in Cayman. Yeah, they could do more. You don't want that curse money on you, honey. You're doing the right thing. God will take care of them and he will continue to bless you, right? 15 G's, I need to start a church. Lord have mercy. Magdalena says, agreed, as a Christian community, we're feeling your duty to our neighbor. We're too caught up in our secularism, rather than following the mandate Christ gave us. For I was hungry and you gave me something to eat. I was thirsty and you gave me something to drink. I was a stranger and you invited me in. I needed clothes and you clothed me. I was sick and you looked after me. I was in prison and you came to visit me. Then the righteous will answer him, Lord, when do we see you hungry and feed? And unfortunately got cut off. But yes, thank you so much for that. All right, so listen, tomorrow's show, I'm going to finish playing the video. We can, see how it ends. There's more to it that I do think is important for you guys to see and to understand. And let me be very, very honest, right? The approach by the Cubans since even last week, Tuesday, has changed. And I'm happy to say that even at the end of this, they were apologizing. They're like, we don't want the Cayman people to hate us. We don't want to come across a particular way. That wasn't our intention. We are just frustrated. Nobody is listening to us, so we are frustrated. All of us can understand what that feels like when nobody listens to you, nobody hears you. Most of you in this country were in that exact same boat. That's why y'all sit down 500-600 people every single day, live, listening to this show, plus the radio listeners, because you know that if you try to do something individually in this country, nobody not paying you no mind. Collectively, we are incredibly powerful. But most of us in this country do not know how to harness our collective energy and resources because we're too busy trying to get clout, individual clout. We're too busy trying to tear each other down and all this foolishness. When you come from a position of, and I had to say this to one of the Cuban guys because he's all up in his feelings in the group about what he's done and he's met with the governor and he's this and that. And I said, listen, Bobo, I don't care about any of that. This is not a pissing competition. I'm not here, right, in this group trying to tell y'all don't do things a certain way. There's a way to do things, and there's a way to try to get assistance. There's a way to highlight your plight, and there's a way not to do it. Aggression is not the way to do it. But this isn't a pissing competition. I'm not here to see who I can outshine and this, that, and the next thing. I don't care about any of those things. I don't need any accolades from the people of Cuba. Okay? I don't even need accolades from my own Caymanian people. Let me be very, very clear. I am moved to help where I can help and to be a voice in this country for a difference, for a change. And it doesn't have anything to do with me looking for attention for myself. Most of y'all do not even know the type of person I really am. I like to be in my little corner doing my own little thing. I like a quiet existence. I'm not that much of an extrovert. I have my two little friends. I like to be, okay, the two of us will go out to dinner. We'll hang out. We're quiet, whatever. I don't need the attention. I'm not looking for attention. Attention makes me uncomfortable if I need to be honest about it. But I also recognize that here on Cayman Mall Road, we have managed to build an amazing platform. And there are people that do listen, and there are people that do pay attention. And that's why a lot of times people come to me and share information and do the things that they do because they're like, Once Sandy gets a hold of it, number one, she like a friggin' dog with a bone. She gonna gnaw that to death. And she's gonna keep on top of it. And she'll circle back around until something is done, right? So yes, me and my big mouth has a place to play in agitating for change. And if you're right, you're right. And if you're wrong, you're wrong. And it doesn't matter to me where you come from or what your situation is or who your mama is or who you're for. If you're on the right side of things, I'm going to be there defending and fighting for you the same way. It's so funny because the other day, we saw this thing with the little young lady there, Amber from Cayman Airways. Somebody said to me, oh, Sandy, but you don't remember you did an article about her some years ago with drinking, did it? And I said, so what? I said, this ain't got nothing to do with that situation. Is she still out there drinking and being sloppy, or has she changed? Well, she says she's found God and she's a changed person. Okay. Give the young lady a chance. She's a Caymanian. Give her the opportunity. And if she has been wronged in this situation, or she has questions or whatever, we want to highlight the situation. Yes, we featured her in the past. I'm sure a lot of people are like, oh my God, maybe Sandy forgot that. That is not the point. The point is, in this situation, if she hasn't done anything wrong, if Cayman Airways has been doing stuff impacting her mental health, then that's a problem. And it wasn't just her complaining, it is other Cayman Airways staff as well. So that shows to me that there is a bigger problem at play here that needs to be addressed by the management at Cayman Airways. All right. Tune in tomorrow. 7:25 is when we get started on air so that we have about 5 minutes to do our news with 106. Somebody says we need to talk about that gangster video. We'll get to that tomorrow. Unfortunately, we can't really play the video because there's so much profanity and stuff in it, but I'm so disappointed in our young people as well, because this is Cayman's future. And some of these young people come from some of the most religious families in all of West Bay. And yet they want to be the biggest, baddest gangsters to go down in history. Well, we know how they're going to go down. It's either going to be prison or with a blaze of bullets. We need to change the narrative with our young people as well and stop pretending like we don't know what they're up to. There's been too much cloaking up of these boys, especially, and even the girls, because they in the mix too. Hardcore criminals we have managed to raise. And yet we want to sit down, because when I found out who that little young man family to and whose niece and nephew he is and all this kind of stuff, I said, wow. And his aunt so-and-so is the same one who can sit down talking foolishness about Jamaicans. The last conversation I had, oh, well, so-and-so, she got married to Jamaican. Can't you do something about it and stop it? And I said, what does that have to do with anything? What you need to be doing is fucking paying attention to the no good children in your family who are probably abused and molested and neglected while you sitting down in church trying to be prim and proper and worried about Jamaicans marrying family members. Get a hold of yourselves, Caymanians. This is the bullshit that I really can't take. Get a hold of yourselves. Clean your own hot mess in your own families and your own homes. You see, but the hate is real. These people hating on gay people, hating on Jamaicans, hating on this expat, hating on that expat. Fix your own house. Because let me be very honest here. If we didn't have some kind of something in the gene pool to kind of take some of this Cayman and ignorance out of it, we would be even in a worse situation than we are now. Don't get me started, please, Jesus. I need to go. But y'all know what I'm talking about. This is the truth. How is it that certain families in West Bay responsible for 80, 90% of the bad breed coming out of there? All these gangsters? How? You know how y'all need to look at your parenting? You need to look at your parenting style, your community style. Going to church is not enough. That does not make you a Christian any more than sitting in a bar makes you a hooker. I'm just saying. Get your life together. Stop coking up these children in their wrongdoing. Tune in tomorrow, good folks. Instagram, folks, y'all be good. Siobhan said, give that a kaboom. All right. Y'all be good until tomorrow. God's willing. We'll be here with more sauce. Ay. All right, I'm going to go shopping. Buy some cleaning supplies today. See y'all tomorrow morning.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.